Is it on? Is that light supposed to be on?
No.
Okay.
Black.
Is it on that TV? Is it on TV?
I'm not sure. I'm ready.
You took the mics away, what happened?
Trip hazard.
Trip hazard.
I'd like to call the meeting to order. First thing we've got on the agenda is suspension of the rules. We need a motion and a second on the suspension of the rules. Is there a, yes, Mr. Fay makes the motion, seconded by Mr. Lightfoot. No discussion, vote, all in favor?
Aye.
Opposed? Carried. Kelly, you have the roll call?
Reagan,
Here.
Forsythe,
Here.
Light,
Here.
Sheridan,
Here.
Smithers,
Here.
Denisha,
Here.
Perkins.
Here.
Akers,
Here.
Fay,
Here.
Haggard.
Here.
Diaco,
Here.
Burke,
Here.
Arquette,
Here.
Terminelli,
Here.
Curran,
Here.
15 present.
Okay, Mr. Denisha, would we like to do the prayer this evening?
Thank you, Mr. Chairman. Bow our heads, please. Dear Father in heaven, we're grateful for the opportunity to gather here this evening. We ask that you give us strength when we are weak, courage when we are afraid, comfort when we feel alone, hope when we feel dejected, and peace when we are in turmoil. May you grant us the humility to be thankful for the many blessings you have bestowed upon us. Let us not dwell on the negative, but look toward the inherent good that most surely exists in all people. When our evening's work is complete, please guide us on our journeys home and grant us all a safe return. For all these things, we ask your blessing through your Son and our Savior, Jesus Christ, in whose name all things are possible. Amen.
Amen.
Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, for approval of the agenda, we've got a couple resolutions on your desk. I think maybe the people on the screen at home, do you have a resolution proclaiming March 21st as Problem Gambling Awareness Month? Does everyone have that resolution? And then another resolution you have is number, it attributes, it's connected with resolution number 26 on page 4. It's by Mr. Akers authorizing the chair to sign a contract for the purchase of sewer vacuum equipment. We're going to need a motion to put the first resolution on the table on the proclamation. And after we get that, then we'll make an amendment to the motion to replace resolution number 26. So who would make the motion to add the resolution of the proclamation? Mr. Smithers, seconded by Mr. Reagan. And now a motion to amend the motion and second on number 26. Mr. Fay and Mr. Larry Denisha, and that is to replace resolution number 26 that you see and that is authorizing the chair to sign a contract with, and put the word in, AQ SEPTENC Group Incorporated for the purchase of sewer vacuum equipment on Northumberland Street Bridge over Morristown Bay project. So that has been, let's vote on that amendment. Are we in favor of the amendment?
Aye.
Anyone opposed? Okay, so now vote on, I guess that means they're added.
Now you need to vote on the amended agenda.
Yeah, a vote on the amended agenda at this point.
Mr.
And
Chair,
so, yes,
point of order.
Yes.
Is there a cost associated with number 26? I don't have that.
You said it, yeah. I can speak to that, Mr. Chair.
okay.
I can speak to that if you like. I can speak to that if you would like.
Yes, go ahead.
Legislator Forsythe, the contract amount that came in for consideration will be for $450,100. So I'm not sure if those were sent as separate attachments or if as one, they were sent separately. We can resend that as well. So when we get to resolution number 26, you should have that one.
Okay, because what I had didn't show the name or the amount, so I just had the.
Right.
Okay,
Right. Yep. Did you hear that amount? Okay.
I did, 450,000. Okay, I'll ask my questions later. Thank you.
You bet.
So we have voted in favor of the amendment and seconded for the amendment. And now it's time to vote on approval of the agenda as amended. Mr. Smithers says yes, and Mr. Second by Mr. Lightfoot. So Smithers made the motion. All in favor?
Aye.
Opposed? Carried. Now we need a motion to approve the minutes of February 1st, 2021.
So moved.
Mr. Larry Denisha makes the motion, seconded by Mr. Smithers. Any discussion? All in favor?
Aye.
Opposed? Carried. Now we have a COVID-19 update, Dr. Williams and Dr. McGuire. Dr. Williams, would you like to go first?
I think I'm going to ask Dr. McGuire is going to go first, if that's okay.
Okay, go ahead, Dr. McGuire.
Okay, thank you. I'm going to share my screen. Can you still hear me? Oh, goodness.
Echo.
Dana, can you hear us?
Give it another try, Dr. McGuire.
You're muted right now.
Right now you're muted, Dr. McGuire. We still can't hear you, Dr. McGuire.
Can you hear me now?
Yes, I can.
That's better.
Coming in very clear now, Dr. McGuire. Go ahead, thank you.
Yes, can you hear me? Okay, great. Sorry about that.
No problem.
Okay, so I'll just give an update where we are with cases to date and where we are with vaccines. So as of today, March 1st, we're just over 6,500 cases. We did report 36 new cases today, and there's currently 18 people in the hospital. There are currently 540 active cases, so those are the ones that we're monitoring in isolation. And just over 5,500 people have been through the isolation process. We have now had 85 deaths since March 25th of last year, and that is up 9 deaths since we did report last week. So this is the graph that I show on a daily basis, what we're seeing with cases. I did also add the red line here that kind of shows like the cumulative cases we've seen since we started the response. So you can see with kind of the trend, it does look like we're kind of going down, but we do have still quite a few spikes that are quite high. On a weekly basis, we have 2 more days. So I didn't add the data that I reported of the 36 cases from this date into here, but we have just over 200 cases this week. And when we look at that on a daily average, we are not really coming down as quickly as I'd like to see. So we're kind of plateauing, seeing about 45 to 50 cases per day, and that's what we've seen for the last 4 weeks. So we did go down after the holidays, but we would like to see this trend go down more as well. With school coming back online after the holidays, we've been monitoring school cases. And so the average for last month was a little bit lower. So we are seeing a decrease there. And within the last month, since colleges had restarted, we did see a steep rise in the college cases. But this week, as well as last, we are seeing those cases come down as well. So that's good to see. To take a look at who is going through isolation and quarantine, like I mentioned, we have 540 people who are going through isolation. Those are those who have tested positive, and 865 who are in the active mandatory. So those are the ones who've been exposed to someone who has tested positive. And as was mentioned last week, during the last week, we did start new guidance for those who have had both of their vaccines, and they've been 14 days since that last shot. And it's been 90 days since their exposure. Those are all the criteria that you have to meet to then not go through the quarantine process. We have just started that. So we've been doing that for the last week. And so just a reminder that if you do get called to be in or as a contact, you still have to go through that interview process. We do have to know that you are asymptomatic, and we have to verify that you did have your 2 vaccines. And so that's still a process that we have to go through, but we are working on that. And so we have seen people then not need to quarantine. As far as vaccine distribution, that is really going well. So last week on Monday, we knew that we were going to receive the vaccine that did not come during week 5. So last week we had twice the amount of vaccine. We got 400 for week 5 and 400 for week 6. So we did both of those, and we just completed that week just today. We did have 4 first dose clinics and 1 second dose. And so all of those went just very well. So we now have just over 2,200 vaccines that we have just provided here to the county as the local health department. And we did find out on the weekend that we were going to be getting 600 new doses this week. So you can see that the allocation is split between that 1B, the essential worker priority group. That still includes those like teachers, college professors, public safety, courts, grocery store workers, for hire drivers. And this week they added hotel workers in that group as well. We have 200 for OPWDD and those with the comorbidities. And then also this week, the supplemental allocation that our department did receive is the 200 for those who are 65 or up. And so we do plan to hold the pod in Ogdensburg this week. So we will be at the Dome. And we just always wait until we have that vaccine on hand before we put the registration links out. And so we will be putting those links out like we did last week. Last week was the first week that we put it just out to the public. We put it out on our website, on Facebook. We shared it with all of our partners. So we're really trying to get it out just as wide as possible. We are trying to educate people that because of the allocations that we do receive, we are supposed to monitor where that vaccine goes for those 3 groups. So we do have 3 separate links, and we need people to sign up in those links for how they meet that eligibility criteria. We also will be at St. Lawrence University again for just about like 400 second doses. And so this has been a real positive aspect of the response. I think all of the clinics have been running very smoothly, and the community seems to be happy with how they are. Registration could get a little bit easier. It is the state site. We are trying to get help, making sure that people know the process. We're trying to provide more instruction because just in addition to the registration, you do have to fill out that vaccine form that gets then sent to the state that shows that you are going to meet the eligibility criteria for the group. We continue to provide our data to the North Country Hub. So the local health department has access to NICIS, which is that system that all the vaccines go into. So we're able to pull the data of what is happening here in the county. So you can see for St. Lawrence County, we have done vaccinations for about 24% of the population. And then by type, so we're still really seeing vaccination by 4 of the main, the provider types. So hospitals, us as the local health department, pharmacies, and the state site. And as a note, I did kind of look up how many doses the pharmacies have done. So from the nursing home point of view, where they did like residents and staff, that's about 1,700 doses that they did. And then at the stores for first doses, so that's mainly the 65 and older group, they've done just over like 5,300. So they actually share just a big portion of what we're seeing here in the county as well. And here I just like to show this because, as you know, the supplemental allocation that our department did receive this week is again for the 65 up. And you can see that the population we have for that oldest group is still higher than where we've vaccinated. So we are trying to make sure that that group does get vaccinated. And then at the bottom, I just kind of point out again for St. Lawrence County, we have almost 90,000 people who can be eligible for the vaccine. And that's because we take out those who are younger than 16 years. And so we have just over 21,000 people who have received their first dose. And that's all I have for today. So I will stop sharing my screen and I will let Dr. Williams share his presentation. Thank you.
Thank you, Dr. McGuire.
So I just wanted to quickly go over a couple of points. So one, I always like to show the national trends because I do think they inform what we're likely to see or what we're seeing here. So as you remember, there was a big peak in January, and now, much like in St. Lawrence County, there appears to be a plateau forming. And what we'd all really like to see is that the descent that we've had in the past month continue. We'll see what happens. In terms of cases, there's nearly 29 million cases. We have more than 500,000 deaths. And right now we've got about 50,000 people hospitalized. There is good news. So as people are probably aware, there's now a third vaccine that's received its emergency use authorization. This is the one by Johnson & Johnson. It's a viral vector delivery system. So basically it gets a blueprint to your body so that you can build spike proteins and develop immunity. As far as safety, there was a phase 3 trial that included nearly 44,000 participants. The safety profile is pretty similar to what we see with the Pfizer and the Moderna vaccine. So people do get arm pain. Some people get muscle aches, fatigue, low-grade fever, headaches. But again, most of these are transient, and they're really just a sign that your body is developing immunity. As far as effectiveness, this vaccine was trialed in multiple countries, including South Africa. And what they demonstrated is that overall the effectiveness was around 66%. But if you looked at just in the United States, which is particularly relevant to this audience, it was 72% effective. But more importantly, in some ways, it was 86% effective in preventing severe disease. And they're reporting that it's 100% effective at preventing hospitalization and death 28 days after the vaccine is administered. So that's a very impressive result. It's convenient, so it's a single shot, unlike the 2 vaccines that currently exist. And it can use standard refrigeration. So unlike the Pfizer and Moderna vaccine that require a real tight cold chain with certain technology, these can just be stored in a regular refrigerator. As far as availability, what we're hearing from Johnson & Johnson, they're talking about up to 20 million doses available by the end of March and 100 million doses by summer. As with the Pfizer and Moderna vaccine, we'll see if they're able to deliver, but they are talking about fairly large numbers of vaccine coming out and being available. Going back to the Pfizer vaccine, there's more and more information available now. And as I previously mentioned, Israel has done a very good job of vaccinating a large portion of their population. And some scientists just published something in a peer-reviewed journal in the New England Journal of Medicine, looking at 600,000 people, so a very large number of people who received the Pfizer vaccine, and they compared them to people who were at that time unvaccinated. They looked at 7 days after people had received their second shot. And what they showed is 94% effectiveness at preventing COVID-19 and 92% at preventing any severe disease. So very similar to what we saw in the original trials. And they also demonstrated that it was effective for all age groups, including people over the age of 70, a population we're especially concerned about. So why is this important? So this is really the first large-scale, real-life example of how this vaccine works. And it did include a number of chronically ill patients. So it really shows what this vaccine can do in the real world. Another important factor, I'm going to talk briefly about variants. So the UK variant, the B117 variant, was circulating widely in Israel at the time that this study was done. So the vaccine appears to be effective against that variant. And then additionally, it seems to start to answer the question of whether these vaccines can prevent transmission. And because it also protected people from developing asymptomatic infection, this would suggest that it does prevent transmission. Very quickly, just about mutations and variants. This is something that's in the news and that's something of real concern. So mutations are basically an accidental change or a mistake in the viral sequence from these viruses. And generally, when these mutations happen, they actually damage the virus or they don't do anything positive or negative. Occasionally, one of these mutations, though, does benefit the virus, and then the mutation spreads. So when we talk about variants, a variant is basically a COVID-19 virus that behaves differently because it has multiple of these mutations. And when we talk about the variants, we're looking at the UK variant, the South Africa variant, and the Brazilian variant. There was just at the end of last week 2 research articles about potentially a new variant in New York City. So again, when you look at these variants, and I did include what people are calling B1526, which is the New York City variant. Again, they're all more contagious. There's some information that the UK variant actually has a longer duration of infection. And one of the reasons it spreads more is because people are just simply ill for more days. Case fatality rate, not much new information there. As far as what's in the US, again, the UK variant, the South African variant, and apparently the New York City variant obviously are all present in New York. And as far as whether the vaccines are working, again, we see that with the UK variant, there's evidence that the vaccine is fully effective. For the South African variant, maybe a little bit less effective, but it still works. And then for the New York City variant, I think the jury is still out. So with these variants, what can we do? And it's important to understand there's certain things that are not in our control. So there's some things just about certain viruses, about their nature. So this is an RNA virus. It's less actually likely to mutate than the influenza virus and less likely to mutate than the HIV virus. Another interesting thing is that duration of illness does increase the ability of the virus to mutate. So there was some research that showed some people who are ill, in an ICU for months with this illness, they actually, in that same individual, are able to create multiple mutations and therefore possibly generate new variants. So more importantly, what's in our control? And the first thing is there's certain selection factors. So IV antibody therapy and also vaccines can actually lead to survival advantages of mutations. So a rapid, widespread rollout of vaccines is especially important. But perhaps most important, the prevalence in the community really allows the virus an opportunity to create these mutations and then for these variants to come up. So ongoing public health measures and vaccination are really the way that we can help to prevent these variants from becoming more of a problem. And then just finally, there's a lot in the national news, there's a lot in the international news about these variants, but what's happening in our region or what's happening in St. Lawrence County? So the UK variant has been documented in Essex County and in Jefferson County. However, before people feel comfortable that it's not in this county, it's very important for people to realize that to identify these variants, there's specialized lab testing that has to happen. And this is not the routine labs that we do in our community or in other communities. So our labs can tell you whether you have the virus. Our labs aren't designed to tell you whether you have a variant. New York State Department of Health is reporting that they're testing a limited number of samples from the North Country region, but they're less specific about what they're doing for testing in our county. We have reached out to some of our colleagues at Clarkson, where they're doing a lot of innovative research on wastewater surveillance. And I'm actually optimistic that by monitoring the wastewater for these variants, we'll get a lot of information in an innovative way, possibly faster than by other techniques. So I think the take-home message here is because we know that the variants are in Essex and Jefferson County, and because surveillance is fairly limited, we should assume that it's quite likely that we have the variants in our community and take appropriate steps. So that's my presentation.
Thank you very much, Doctor. Any questions of the doctors? Go ahead, Mr. Spivak.
Yes, I have a question. Do we have any indication so far or any reliable information about the length of time that any of the vaccines are effective for?
So there's, every week or so, there's more research that seems to demonstrate that these vaccines are continuing to show effectiveness, months after they're administered. We're not going to have a final answer to that anytime soon because, these vaccines are new. But all the research seems to indicate that they continue to last for months after they're administered. When we talk about things like 90 days with public health quarantine rule, that's just because we're very confident that they work for at least 90 days. And I'm hopeful that they're going to be proven to work for many days after 90.
Thank you.
Yes, go ahead, Mr. Forsythe.
Thank you, Mr. Chair. Dr. Williams or Dr. McGuire, what is the average age of the 85 deaths? Do we have an average age?
I don't have that right now. I can get that for you.
Because earlier on, I believe it was 71 or something. And I just wonder where it's at now. And my follow-up to that, once you know that, would be, do you have a guesstimate of the first phase let's say 70 above, what percentage have been vaccinated of the population of this county?
So we have the North Country data. I will see what we can pull from our nicest reports and see if I can do ages.
Okay, well, I'll be interested in just, I guess, see where we're at with that, but, okay, thank you.
Sure.
Yes, go ahead, Ms. Haggard.
Thank you, Mr. Chairman. Either doctor could answer this with whoever feels they can. There is still quite a bit. I talked to a lot of people. There's a lot of vaccine hesitancy, or they're not going to get the vaccine. And I know that's up to the individual, of course. We can't force people. But is there any way that through either of the organizations that you two lead that we could dispel some of this misinformation?
In the hub that we're part of, there is access and a communication to subgroups that we work on. And so they have pulled people from all counties to try to reach populations that they feel will not be vaccinated and to get certain messages out. So that is what they are working on, so that we get a standardized message, not just in our county, but in the North Country region as a whole. So we get an update and we have a meeting on Wednesday morning. So I will learn what they have for that and then get that back out to you as well. But they are supposed to be getting messaging, one that we can do for social media and other outlets that we can get out to the public.
Thank you, because I think social media might be the exact place where some of this originates. Thank you.
I think also there's an opportunity, as a physician and in the healthcare community, now that people with comorbid illnesses are eligible. I know many of my provider colleagues are spending a lot of time when people come to the office, to talk about their diabetes care, to talk about their treatment of hypertension. We're really trying to incorporate education, one-on-one education, which is a slower process, but I think is very meaningful. So I think, like many things, it's going to take multiple approaches, and I think healthcare providers, nurses, NPs, PAs, physicians are going to have a big role in this. I think with the Johnson & Johnson vaccine, that may be a little bit more easy to handle in providers' offices. You might see in the future that when you go to your provider's office, they may have some vaccine on hand. That has not happened yet, but it's possible it will. And that'll be a nice opportunity for people to get vaccinated, maybe when they go to their provider's office.
And Mr. Chair, if I could just follow up to something that Dr. Williams just said.
Go ahead. Ms. Haggard.
Thank you. I understand the Pfizer has changed somewhat the restrictions on the temperature. So maybe that will help people have more access. Is that correct?
It is. I think there's still, really with all three vaccines, there are some challenges. These vaccines don't use preservatives, which is nice in terms of them not creating, allergic reactions maybe, but it does pose some challenges in terms of once you open one bottle, you have to administer all the vaccine that's in that bottle, or otherwise you waste it. And we're really trying not to waste it. So that's a challenge that all three vaccines share.
Thank you.
Legislator Reagan.
Thank you, Mr. Chairman. My understanding, you said that we've vaccinated at least first vaccine to about 24,000 people. Is that correct?
Just over 21,000 people. It's about
21,000. So basically 20% of the county's population has been vaccinated at least once. And considering the problems that we're seeing around the country and around the state in terms of the rollout, I think we should be very proud of the fact that so many people have come forward, gotten their vaccinations, and the terrific job that our public health department and our hospitals and the state of New York's site in Potsdam have done. I mean, it's, I think, remarkable, and great strides have been made. And, you know, I think that as the Johnson & Johnson vaccine comes out, and we're already seeing this, the state is giving us larger quantities of doses, there's a great deal for us to be optimistic about and thankful to our healthcare providers who have done so much, and the volunteers who've come forward at a lot of the county's clinics and the Potsdam clinic. You know, I know nurses who offered their services for free, all kinds of people from all walks of life who have come forward and are making a real difference.
Yeah, and if I could just state, so the data that I provided is from last week. So either tomorrow or Wednesday, there will be new stats up. So that number is probably even higher. And you're right, for us to run the pods that we do, it takes a lot of staff. And so from our department to the other county departments to all the volunteers that come to more than one pod, and we have so many people with this. And from the institutions, from St. Lawrence University, from the Dome, from the hospitals where we had them this last week. I mean, it has all went very well. And it's just very nice to see, you know, like a positive aspect to this response, because it has been a long year, and it's nice to see the smiles back on folks' faces.
Have we collected a list of the names of the volunteers?
Yeah.
Yes, we have.
Okay, I would like at some point in the future, if we could do a resolution by this body thanking these people and sending them a resolution, not, you know, with every name on each resolution, but something indicating the appreciation of this board for their efforts.
I think that's a great idea.
Any further discussion or questions to the doctors? I'd just like to add, you're both doing a very good job for St. Lawrence County, Dr. McGuire, Dr. Williams. We really appreciate your lead in this effort.
Thank you.
Okay, let's move on to communications. Kelly, do you have any communications for us?
Yes, we do have one correspondence for communications and 3 emails for citizen participation. The first card was received from Legislator Bill Sheridan and his family, thanking the Board of Legislators, County Administrator, and Department heads for the floral arrangement and kindness shown to him and his family on the passing of his father. For citizen participation, I have an email from Laura McGrath of Madrid. She writes, Dear St. Lawrence County Board of Legislators, during the past year, I've followed the efforts of the St. Lawrence County to conduct police reform per the standards of Governor Cuomo's Executive Order 203. As a supporter of the North Country Committee of the New York State Poor People's Campaign, I am writing to express my dissatisfaction with the police reform process as conducted to date. Communities and police departments across our country and our state are recognizing that people of color make up a disproportionate number of arrest and prison sentences. This reflects the fact that individuals and as a society, we are perpetrators of racial bias. From the national level to small towns like ours, we have a responsibility as citizens to explore our own biases and to root our systematic racism in our government agencies. Executive Order 203 requires a comprehensive review of current police policies and practices and of particular needs of the community. What was the strategy for review and needs assessment? In St. Lawrence County, the Sheriff's Office held 2 public meetings on October 14th and October 21st, and a police reform resolution was approved by the Board of Legislators on December 21st. In my opinion, 2 public meetings do not provide sufficient opportunity for community involvement. Why were there not more meetings throughout the county and/or community surveys? We still have time for input until the deadline for the reform plan in April. How does the county's reform plan address the disproportionate targeting by police of people of color? What will the Sheriff's Office do to combat bias in policing over and above the occasional implicit bias awareness training? How did the Sheriff's Office and the Board of Legislators involve people of color in needs of assessment and planning? Members of the Sheriff's Office and Board of Legislators are undoubtedly aware that there have been public demonstrations in many towns throughout the county to support racial justice. Demonstrations have taken place regularly through the summer, fall, winter this year. Representatives of the local Black Lives Matters group and local chapter of the Poor People's Campaign. Have these groups been contacted for assistance with planning? I would recommend that the county establish a citizen review board to ensure an open citizen-controlled process for preserving the integrity of local law enforcement, providing accountability to the public, and offering a forum of ongoing citizen concern and input. The next one is from Jack Carney, North Country Access to Health Care Committee, the Poor People's Campaign. A national call for moral revival has designated respect for the rights of indigenous people of one of its priorities. One of our members, a member of the Shinnecock Nation, has called our attention to the campaign of illegal harassment being waged by New York State Department of Transportation. The Shinnecock Nation has constructed 2 monuments, 50-foot electronic billboards on the Sunrise Highway where it crosses the Shinnecock Reservation. The monuments have been constructed to raise awareness by people on the highway of the fact that the Shinnecock still occupy their ancestral lands, and to raise about $1 million a year for the nation's health center, public safety, daycare, and other programs by rental of billboard space. The Department of Transportation has demanded the removal of the signs this month, threatening their destruction and $1,000 a day fine to the nation if they are not removed. Why? The Department of Transportation claims the signs violate the same federal highway laws, manual on uniform traffic control devices for street and highway that require the removal of the 514 signs on the New York State experience you had displayed on highways throughout the state. The reality is that legislation explicitly exempts Indian tribal lands. The DOT also claimed the Shinnecock gave it in 1959, but that was unilateral agreement by the DOT in which the Shinnecock did not participate. The tribe asserted it has met all state rules for roadside construction. What are the real issues? The affluent white residents of the area assert the monuments offend their aesthetic sensibilities. Perhaps even more to point, powerful members of the dominant culture are often discomforted by having to acknowledge the presence of economically distressed people near them, particularly when those people from whom ancestral lands was stolen. Regardless of the DOT's actions are illegal. We urge you to order the DOT promptly to cease and desist its participation in the challenge to the Shinnecock Nation's sovereignty. The last one is from the leadership team of the New York State Poor People's Campaign to the St. Lawrence County Board of Legislators. In June 2020, Governor Andrew Cuomo issued Executive Order 203, which required local governments that operate police forces to submit a plan which described how they will reform their police operate in the community. In St. Lawrence County, the Sheriff's Office began to work on police reform plan. The sheriff held 2 public meetings, October 14th in the afternoon and October 21st in the evening. On December 21st, the Board of Legislators approved a police reform resolution. The leadership team of the New York State Poor People's Campaign, North Country Committee, believes that St. Lawrence County's efforts to conduct police reform does not meet the standards of Governor Cuomo's Executive Order 203 because the effort does not address the particular needs of the community served by such police agencies. The effort does not promote community engagement to foster trust, fairness, and legitimacy. The effort does not address any racial bias and disproportionate policing of communities of color. We have not seen a County Police Reform Plan. We have only seen a PowerPoint presentation and a board resolution. Will the county submit a PowerPoint presentation to New York State? Where is the plan? The Village of Canton has a police reform plan on its website and invites public comment. Why doesn't St. Louis County do this? We do not feel that 2 public meetings held more than 5 months before the deadline for submission of a police reform plan provides sufficient opportunity for community involvement. Why were there no community surveys? Why were there not meetings in every community? Why was there no continued public outreach? Why can't there be additional public meetings between now and April? New York State reports that persons of color make up 7% of the county's population, but account for 15% of all arrests and 21% of felony arrests and 25% of all those sentenced to prison. Has the county's reform plan addressed these statistics? What is the county's response for these statistics? What will the county do to make POC are not disproportionately targeted by the police? Did the Board of Legislators of the Sheriff attempt to involve people of color in their reforming plan? If so, when? What groups? Did the Board or the Sheriff involve Black Lives Matters groups? Did the Board or the Sheriff involve the Poor People's Campaign? Representatives from the Poor People's Campaign attended the public meeting held in October, as well as public meetings held in July. They can attest that these meetings were basically presentations, not opportunities for community discussion. Was the Board of the Sheriff's Office aware of public demonstrations to promote racial justice, including fair treatment by the police, that took place over the county throughout the summer and into fall and winter? Over 1,000 people marched in Potsdam on June 1st. More than 200 persons attended a demonstration in Canton the next weekend. Demonstrations and marches were held in Gouverneur, Messina, and Ogdensburg, and other communities. Did the Board or the Sheriff attempt to involve the people who organized these demonstrations or who participated in these demonstrations? If yes, then how? If not, why not? The Poor People's Campaign is aware that the Sheriff's Office has proposed to have all of its offices wear body cameras. This is an important step and we support it strongly. We demand that the Board of Legislators support this body camera program through the budget. The Poor People's Campaign is also aware that the Sheriff has proposed to hold a public meeting 4 times per year in locations around the county. This is not sufficient outreach or community involvement. The Poor People's Campaign demands that the county establish a citizen review board to ensure an open citizen-controlled process for providing public accountability over the powers exercised by local law enforcement. Preservation of the integrity of local law enforcement and a forum for citizens' complaint regarding local law enforcement to be heard and reviewed fairly and impartially. Smaller communities that maintain local police forces might be invited to participate in a county-level citizen review board. The leadership team of the New York State Poor People's Campaign, the North Country Committee, stands ready to work with St. Lawrence County to achieve police reform that addresses the needs of communities served by the Sheriff's Office, that promotes community engagement, and that addresses racial bias and disproportionate policing of communities of colors.
Thank you, Kelly. Next, we have a citizen participation. Any citizen wanting to address the board is asked to stand at the podium during the time they address the board. The address will be limited to 5 minutes. Please state your name before beginning and your township, not necessarily your address, but your township. Go ahead.
May I take this off when I speak?
Sir.
My name is William Room. I live in Madrid, lived there for 20 years. Got kids, grandkids. I came here tonight to speak to you on a couple of things that you did last month. You've already heard about Order 203. I was going to comment on Eileen Raymond's comment where she said you didn't allow enough time for the public to react and that December 21st was not a good time. And she requested that you guys continue this important topic. And then the other one I wanted to address tonight would be you recently designated January as Sexual Awareness Month. So I'm with a group of women, and we've been working really hard to get the news out there. One person I work with, her daughter was actually sexually trafficked, and She has a tattoo here, and hopefully I can get her to come and talk to you some night about that. But what we've been trying to do is we've been trying to go to different schools and just bring awareness to it. So first I'd like to talk a little bit about rule number 203 and how it relates to me. And then I'd like to talk about your sexual awareness and how it relates to how 203 pertains to me. Okay, so I've never had a criminal record. I've lived 53 years. How much time do I have?
I think you got about three minutes.
Okay, I've never had a criminal record. I've lived about 53 years. I've had a clean license for 53 years. About 4 years ago, I was a whistleblower for what I saw as far as sexual harassment. And I have no condemnation of the police. I am pro-blue. But since over the last 4 years, I've been visited 35 times. It took 730 days for me to get charges of stalking dismissed against me. I am now 1.5 years without a license, still awaiting trial for that. So one of the issues I have with Rule 203 as it pertains to me is where's the equal justice? I'll give you a case in point what happened the other night. We went with our 3 lady friends to speak at the school. My friend whose daughter was abducted spoke. As we were leaving, the school board president's husband followed her, tried to run her off the road, and then we called the police, 911. No one responded to us. No one came and took any complaints. They went to the person who committed the crime that we saw as a crime. I've also had experience that the basic police force is dishonest. I was told after I was arrested for my DUI that they are taught to lie to convict people. If we can't trust the police, who can we trust? How can we trust to talk to them? How can we trust to let them help us? If they can't trust them, they become the SS. And then they do political favors for relatives and people of authority. We can't have a police culture of lies. The other thing I need to tell you is that sex trafficking is not organized crime. It's not kidnapped victims. I'll tell you where it's happening and you're not going to like it. It's happening in our schools. That's right. Girls and boys from fractured homes, poor girls and boys from fractured homes. What I heard tonight, poor people. Young teachers take these girls back to their apartments, trade sex for drugs. Then they share them between friends. It's happening today, people. It's happening in our schools. The insidious plot that I fear, though, is that people who did this years ago are doing it now, only these girls become a commodity because they're older and have more authority. That's right, I'm a whistleblower. I saw a teacher do something bad in a school. My wife was hurt by the same teacher. And for the past 4 years, I've had the police and I've had people speak out against me. Eventually, all my legal matters are going to go away. I'm not asking you guys to do nothing for that. What has been done to me doesn't really matter. I will not deter from speaking out against pedophiles and sexual predators. I will not stop. For this board, I would like to say one thing. It is right that you made a declaration of sexual trafficking. It is right that you equipped your officers with webcams. It is right that the police are talking about reform. I ask you to continue to do that. One last thing, and very, very quickly, because I'm all out of time. One of the ladies said that she was contacted by the undersheriff and All the ladies said they didn't connect with him. One way we can start to get victims talking is to create a safe place for them to talk. They are not going to talk to a male authoritative figure. Thank you very much.
Thank you. Okay, any more participation? Public? Let's move on to resolutions. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with St. Lawrence Health Systems for the tuberculosis program in the Public Health Department and move for its adoption.
And Mr. Smithers seconds it. Any discussion? All in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution modifying the 2021 budget for community services for funding from the Office of Justice Programs and move for its adoption.
Is there a second? Mr. Fay seconds. Yes, Mr. Fay seconds. And is there any discussion? No discussion? We need a roll call vote.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
15 yes.
Carried. Mr. Lightfoot.
Mr. Chair, I offer a resolution authorizing the chair to sign a contract with Matthews Specialty Vehicles for a mobile treatment clinic and move for its adoption.
Second by Mr. Smithers. Any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chair, I offer a resolution authorizing the renaming of community services chemical dependency clinics to St. Lawrence County Addiction Services and move for its adoption.
Is there a second? Ms. Rita Kern and Ms. Haggard, seconds. Go ahead. Any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with 1011 Group for behavioral health, electronic health records, and billing software, and move for its adoption.
Is there a second? Ms. Kern seconds. Any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with Seaway Valley Prevention Council for coordinated peer services and move for its adoption.
Seconded by Mr. Denisha. Any discussion? All in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution appealing to Section 10 and St. Lawrence County School Districts to let them play and move for its adoption.
Seconded by Mr. Akers. Any discussion? Mr. Akers.
Well, I applaud that, it's my understanding that Section 10 is moving forward with sports. Kids are practicing, and working with their teams, and competition will be starting, I think, very soon. I think that when this is all over with COVID, that the true costs, which are not being measured now, the loss to society of our social interactions has not been measured. We've been good on measuring fatalities. I think in this particular subsection of this age group, the 99.99% that can play and interact without falling to the virus. It's important that we move on and let them rejoin society.
Thank you, Mr. Akers. Any other discussion? All in favor?
Aye.
Opposed? Carried. Ms. Kern.
Mr. Chairman, I have a resolution modifying the 2021 budget for the Sheriff's Office for forfeiture reimbursement from a county surplus auction, and I move that resolution.
Seconded by Mr. Reagan and Mr. Forsythe. Any discussion? All in favor?
Aye.
Opposed?
Roll call.
Oh, excuse me, roll call, yes. Roll call vote.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piacco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Kern,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
15 yes.
Resolution carries. Ms. Kern.
Mr. Chairman, I have a resolution authorizing the chair to sign Federal Equitable Sharing Program Agreement and the annual certification report, and I move that resolution.
Seconded by Mr. Smithers. Any discussion? All in favor?
Aye.
Opposed? Carried. Ms. Kern.
I have a resolution proclaiming the month of February as Black History Month in St. Lawrence County, and I move that resolution.
Seconded by Mr. Denisha. And Ms. Haggard, looks like her hand's up. Mr. Reagan? Any discussion? Yes, Mr. Akers.
So I think it's important that this resolution takes place, but I'm also wondering is in the issues of unity in identity politics, is there a month for Native Americans? Is there a month for Asian Americans? Or is there a month for Hispanic Americans also?
There actually is a month for each and a bunch of other stuff too. And you'll see them as they go through the year.
Any more discussion? No more discussion? All in favor of the resolution?
Aye.
Opposed? Carried.
Have that one extra resolution, Mr. Chairman.
Yes, we have that resolution.
Proclaiming-
Yeah, go ahead and offer it.
Proclaiming March 2021 as Problem Gambling Awareness Month in St. Lawrence County. And that was brought to us by the National Council on Problem Gambling and the New York Council on Problem Gambling and Central Regional Problem Gambling Resource Center. And I move that resolution.
Okay, seconded by Mr. Forsythe and Mr. Reagan. Tony Arquette. Any more discussion? Mr. Akers.
So I don't have the body of the resolution in front of me, I'm just working off the agenda. In the body of the resolution, is there any effort to actually eliminate gambling? Anybody answer that?
Should have a copy on your desk. There's not one.
Oh, here. Okay, so it appears to me that there's no effort by these groups actually to eliminate gambling. That is actually just is claiming that it's a treatable disease. It doesn't say disease, but treatment to minimize the harm to individuals and society as a whole. And I just want people to be aware that the New York State Lottery, which is advertised heavily on our daily television shows or whatever, that they netted in the fiscal year of 2017 to 18, they netted $9.97 billion. And actually in 2019, they netted $10.291 billion. And this year for 2020, we're down a bit, but it's $9.741 billion. So we are part of, the state is actually part of the promotion of gambling. And what I see, not to be judgmental, but when I see, if I'm into a convenience store shopping for a beverage or whatever, I look at the individuals that are lining up to purchase lottery tickets in whatever form. And to me, it looks like a regressive tax on the poor. We know the county itself benefits from gambling. The Mohawk Casino has over 800 jobs, and they're fairly good paying jobs. We also know that the county receives gambling money, although I think we're in arrears right now. Is that correct, Mrs. Doyle?
I believe so, yes.
Okay. But up to, what would you say that we received last year, $1 million per year? Would it average the amount of monies that we've received?
Are you referring to tribal state compact funds?
Yes.
Yes.
So, I guess that's just my point. I will support the resolution, but I think to be fair, that we are part of the problem. So New York State is part of the problem of this issue. And that's my point. Thank you.
Thanks for helping us be more aware. Any other discussions? Yes, Mr. Arkley.
Thank you, Mr. Chairman. I don't disagree with some of Mr. Akers' comments regarding the compact money and the fact that we have received it, utilized it in our budgets for many years now, along with the towns of Brazier and Messina. But I also represent the area that aligns itself with the reservation, and thus the casino. And I have seen firsthand the devastation that the gambling addiction can cause. I've seen small businesses fall to the wayside because it's an invisible disease, and it doesn't care what age you are or what diversity you are. It's potentially can destroy folks, and I do appreciate when we are able to utilize compact monies to make life better for folks in our county, but I also recognize the detriment. I'd like to be added as a co-sponsor for this, and I'll be supporting the resolution.
Thank you. Thank you, Mr. Arquette.
Yes. Your hand's up in front of your face. I think that's got to be Mr. Burke. Go ahead, Mr. Burke. I see you. Okay.
There is, just to point out, we also tax alcohol and we also tax cigarettes. It's part of our society. It is the way it is. And I think problem anything is not desirable. Problem gambling, problem drinking. My opinion, all cigarette smoking is problematic because of what it does to people's health. But again, I think it's been pointed out time and time again by different members of this body that people have the right to make those decisions, and we just hope that, again, by this resolution, that we bring awareness to the fact that problem gambling can be devastating.
Any further discussion? All in favor of the resolution?
Aye.
Opposed? Anyone opposed? Carried. Mr. Akers?
Thank you, Mr. Chairman. I offer a resolution authorizing the chair to sign a contract with Systems Development Group Incorporated for licensing, hosting, and software support for the ImageMate Online for the real property office. I move this resolution.
Seconded by Mr. Smithers and Ms. Kern. And any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution approving New York State Department of Transportation Supplemental Agreement Number 1 for final design for St. Lawrence County Bridge Preservation, 2 bridges, which are bins number 3340-980, bin number 3341-780, and pin number 7753-96. I move this resolution.
Seconded by Mr. Denisha and Ms. Kern. Any discussion? There being no discussion, all in favor?
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract for shared services between New York State Department of Transportation and St. Lawrence County. I move this resolution.
And motions, or seconded by who again? Okay, Mr. Lightfoot and Mr. Smithers. Any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with Barton LaJudas, DPC, for spill prevention control and for a county measure plan update and modifying the 2021 budget for the Department of Highways. I move this resolution.
Seconded by Mr. Denisha. Any discussion? All in favor?
A roll call.
Oh, excuse me, roll call.
Mr. Smithers?
Yes.
Denisha?
Yes.
Perkins?
Yes.
Akers?
Yes.
Fay?
Yes.
Haggard?
Yes.
Biacco?
Yes.
Burke?
Yes.
Arquette?
Yes.
Terminelli?
Yes.
Curran?
Yes.
Reagan?
Yes.
Forsythe?
Yes.
Lightfoot?
Yes.
Sheridan?
Yes.
15 yes.
Carried. Mr. Akers?
Mr. Chairman, I offer a resolution modifying the budget for Workforce Innovation and Opportunity Act for fiscal year 18 for the Trade and Economic Transition National Dislocated Worker Grant. I move this resolution.
Seconded by Mr. Smithers. Any discussion? No discussion? Have a roll call vote?
Denisha?
Yes.
Perkins?
Yes.
Akers?
Yes.
Fay?
Yes.
Haggard?
Yes.
Biacco?
Yes.
Burke?
Yes.
Arquette?
Yes.
Terminelli?
Yes.
Curran?
Yes. And sorry, the dog's also seen somebody go by.
Reagan?
Yes.
Forsythe?
Yes.
Lightfoot?
Yes.
Sheridan?
Yes.
Smithers?
Yes.
15 yes.
Motion carried. Mr. Akers?
Mr. Chairman, I offer a resolution modifying the budget for the Workforce Innovation and Opportunity Act for fiscal year 20 for Employment Recovery National Dislocated Worker Grant. I move this resolution.
Seconded by Mr. Smithers. And Ms. Kern. Yep. And any discussion? No discussion? Roll call vote?
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Kern,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
15 yes.
Resolution carries. Mr. Akers?
Mr. Chairman, I offer a resolution authorizing the chair to sign and transfer a utility easement for a portion of the former JNL site to National Grid. I move this resolution.
Seconded by Mr. Lightfoot and also Mr. Denisha. How about Ms. Kern too? Second. I got you right. Larry, you want to speak on it?
Yeah, just
Discussion? Go ahead, Larry.
Yeah, just briefly, I'm sure everyone is supportive of this. I certainly hope they are. Passing this resolution is going to help us with any potential future redevelopment of the site. So it is key that we pass this resolution.
Any other discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with Allied World Insurance for medical malpractice insurance coverage for county employed medical providers. I move this resolution.
Seconded by Mr. Lightfoot and Ms. Kern. Discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution to modify the 2020 budget for social services for foster care, adoption services, heat, and technology. I move this resolution.
Seconded by Mr. Forsythe. Any discussion? Mr. Burke? Go ahead, Mr. Burke.
As it relates to foster care, 7 months from today, October 1st, the family's first law goes into effect. And I guess I was wondering if maybe if Cindy's available, if she could talk about the children in foster care and what's being done, where we need to go. I think 7 months isn't a long time to reduce our numbers, and if she wouldn't mind giving us an overview, if with your permission, Mr. Chairman.
Yes, go ahead. Cynthia, are you on?
Good evening.
Good evening.
There we go. I can give you definitely some numbers. As of the end of February, we are up to 345 children back in care. And with that is an additional 11 that has not been added to that number that we took in last week. In addition to that, in that program is another 220 plus preventive cases that are being followed. So each of those caseworkers currently have 30 plus children on their caseloads. That is, the risk tolerance for those caseloads are 12 children plus. For Child Protective Services, for the month of February, we had 152 new case calls. So now we have a total this month of 595 cases. So the caseloads are now in CPS up to 25 cases per caseworker. And again, the risk tolerance for that unit is 15 plus cases we have to report that any cases over 15 goes in, we have to report to the state. I actually had the opportunity to sit with OCFS again today in my office for 2 hours. They came in today to do a assessment on our programs that we're going to be that we're working on now that will be affected by Family First. So what they did is they came in today to get a basic baseline of what we're doing and how we're doing it. Everything is, you know, spot on. A couple little things that we need to adjust, but we are actually doing a really good job. But what's going to happen with Family First is that's when we start risking our reimbursement rate. So with the baseline that they came in to get today is what they're going to be utilizing when it comes to, you know, how we're progressing with our children in care in regards to our 50% plus for kinship, for children that are in kinship homes. And it will also be in regards to our congregate care level to be 12% or below. So those are, that's basically what they were checking on today. But in addition, I spent, after we went over the review, we spent a couple hours talking about Family First. I think as some of you are aware, we have OCFS that we may have to meet with every Friday from about 10 to noon in regards to our late cases and some of the issues that we've been having in reaching the mandated, our mandate. You know, we have to have 7, our cases have to be, any call that comes in, the case has to be taken care of, or our first call has to be within 24 hours. We're pretty good on that. Second comes the 7-day risk assessment, safety assessment. We are late on those, not all of them, but we have about 30% of our safety assessments that are late. And then we have our 60 days to complete our CPS cases. And we are approximately, I received a list today. The list looks like this. It was about 7 pages long. I counted them. We have approximately close to 300 cases that are over 60 days. Some of them are even totaling, if I look quickly, at 230, 235, 125, 145. Again, it's the resources, you know, that we need to be able to move forward. So in a quick shot, I can say that we've been working on a basic 3-year plan. You know, we worked on the staff that we're going to need to, or the resources that we're going to need to move forward, not only to, you know, kind of get things under control, but to move forward with Family First. So the 3-year plan is, the first year is, you know, getting things stabilized, resources we need, getting things kind of under control, getting our policies and procedures in place, and starting to follow, you know, the Family First and increase our preventative services so that we can keep kids out of care, get kids out of care sooner. The second year is going to be strictly working on stability of the program, making sure that we are following everything and that we get strategically, you know, are following what we need to make sure that we're maintaining the program. The third year, we're going to be looking at, you know, working strictly on reduction of the children in care. We want to see right now our cases are going up, but our children that are in care are not coming down. That's what's kind of our numbers. So we need to work on getting our children out of care sooner. Our average child remains in care for over 600 days. I think we're about 611 at this point. The national average, I was talking to OCFS today about, and the average is about 300 days in care. So we are double that with our children in care on a national average. So strategically, again, we're working on a 3-year plan, but we have to have the resources to be able to do that. We've looked at about a 4-month plan of bringing in staff. I know that getting, you know, a whole bunch of staff at once is not going to be productive or effective in any way. If we bring them in strategically, about 10 at a time or so, we can get trained, you know, and get the quality of staff that we need to move forward. Hopefully that reduce our turnover of staff. help us be able to retain staff and move forward with these new mandates coming in.
But I could one follow-up, please?
Go ahead, Mr. Burke.
Cindy, and you did a presentation for several of us not long ago, and a figure sticks in my mind. Nearly $17 million we've lost. It cost the taxpayers over the past 7 or 8 years. Well, and I think, I think as legislators, we have to own up to that failure. I think that kind of loss of money, because we weren't astute enough to know that critical investments at the right time save us money. So instead, we've lost millions of dollars for the taxpayers. And I guess, and I'm just talking the dollar amount. This doesn't begin to touch the human cost. When we have people in placement for an extended period of time, there is a tremendous human cost associated with that as well. And I guess, Cindy, I know, when you did the presentation, I think everybody that's listening to this needs to know you've been on board for a very short period of time. You walked into this this situation, this crisis, and I think as legislators, I think we have to own up to the fact that in the past, when people were asking us for help and telling us that we needed help, we should have been more responsive, and we should have been on top of this. But instead, you bear the burden now, Cindy, and I think that I think you're doing a great job, but it's a huge challenge. And I would like to, under new business, if you're going to be available, I'd like to ask you another question as well. Thank you.
Any more discussions? Mr. Lightfoot.
Cynthia, because of another issue, I wasn't able to be on the entire part of that call the last time that you gave a presentation. And I'm completely ignorant of the $17 million and where that came from, obviously over a period of time. What I would like to know, and I don't need to know it right tonight, but I'd like some figures on that, how that happened, where it happened, and why it happened, along with some documentation as to the amounts. Not that I don't believe you, I just want to see where it is. And what, if anything, we overlooked, if anything, while this loss was being accumulated. Let me see.
We actually did tape our presentation. So if there's, anybody that wants to listen to it, I can pass out that link. The numbers though, like when we talked that night, the number was up to $17 million, 17.2 million. Since then we did get some revenue in. So we were able to re-evaluate and bring it down to about 16 million for 2020.
16 million down to 60? Okay.
And that's basically an accumulative amount. What we did was we did research back, and I can try to make this quick. We did research back for the last 25 years of all the Department of Social Services in New York. And we looked at the number of children, back from 1995, and we rated the counties all the way up through I think it went to 2019. We rated the counties. And we noticed that we were one of the few counties that drastically increased from about 2015-16 up to 2019-20. So then we started looking at, okay, let's kind of graph this out so we can see it better. I think when you graph something, it becomes more clear. So we were able to graph out our number of children in care and what that cost would look like. So we basically took the cost of when we were kind of basically, I don't want to say flatlined, we kind of had a curve, you know, of children from anywhere from 120, 130 down to 96. We kind of ran that fine line, so to speak, for many years. Maybe a couple of years went up a little bit or down a little bit. But for the most part, we stayed about that average. In about 2015-16, we took almost like a straight curve upward. So what we looked at is what the cost would have been having, you know, keeping on with our 120 kids in care or so, like our average at that point, and what that would have looked like moving forward versus the 240 extra children that we ended up with in care. So we tried to accumulate that cost over the 5 or 6 years, and that's where we came up with the $16 million.
Okay. If I may?
Yes, go ahead, Ms. Lightfoot.
In one of our last conversations, you talked to me about your learning of other counties with higher populations and many fewer children in the care and custody of CPS, and that you were going to reach out to them to try and find out what their process and secrets are. Any success with that? And I'm not looking for any results, just were you able to make those contacts?
Yes, I reached out to several counties. Again, it comes back to caseload numbers. What I tried to do this time, instead of kind of looking at the counties that, you know, instead of comparing apples to apples, because really with our number of children in care, it's really hard to compare that way. So I started looking at, okay, what counties actually have high rates, you know, are meeting all their mandates. You know, they have their safety assessments done on time. They're getting their cases completed within the 60 days. How are they doing this, and how are they actually bringing their children down in care instead of going up? A lot of it is resources. A lot of it is staff training. Staff training seems to be huge. I actually, through OCFS, they gave me the contact for Oneida County. Oneida County just revamped their whole training process. So we're in the process now of, I reached out to them, and we are going to set up some interactive training with them on how they were able to revamp their whole training process. The problem is our staff are on the fly constantly. So, you know, to be able to provide them with extra training, hands-on training, additional training, it can't happen. There's just not the time. So that's another huge piece of it. The main feedback was resources and training.
Thank you.
Any other questions of Cynthia? Mr. Forsythe, go ahead.
Thank you, Mr. Chair. Thank you, Cynthia. It just puts me, I guess, and probably several others at a huge disadvantage on this conversation. I wasn't aware of the meeting. Second of all, I haven't seen any of the numbers. I haven't seen any of the stats. So it makes it really hard to intervene in this conversation. So if anything you can get us for information, Cynthia, I'd appreciate, because
Yeah,
I really don't have a clue what's going on.
I can absolutely send it out. And I think what we tried to do is look at, you know, okay, where did things go awry? How long has it been going on? And what can we do to, you know, to reverse the curve? So,
Yeah.
you know, I think that we have a really good team at Social Services. Like the management team, Heather Rand, Heidi Susi, Colin Mackey, our financial manager, you know, Dave Haggard, our legal advisor, Wendy Lemke is our administrative assistant that works for, I call it the third floor, Child Protective Services, foster care and preventive. You know, we meet once a week for about 3 hours, probably more than that. That's probably being, you know, it's probably more like 6 hours. But, you know, we've really been working at trying to look at this strategically so that we can move forward and not have to move backwards. You know, if we can continue to move forward to find a solution to this, I think, you know, it may be a little bit, might cost a little bit in the beginning, but by, you know, at the end, getting through this is going to by far, you know, I believe save the county millions of dollars.
And I appreciate that. You know, John's concern he raised about $17 million. I've never heard that number. So, you know, that's a legitimate concern without a doubt. I just like to see what happened and what's transpired. So thank you. Any info would help. Thanks.
Sure.
Mr. Reagan.
Cynthia, the 2015 to 2020 sort of corresponds with the peak of the opioid and heroin epidemic that has struck the county, and that has, you know, been responsible for forcing the county to take rescue children who are in homes where they're not being taken care of because their parents are in the grips of addiction. And you know, I think over the past 2 years, this board has taken a lot of steps that, you know, will over time help have some impact on this opioid crisis. And you know, whether we're talking about the new medical assisted treatment program, or the additional child protective workers that we've added, the other programs that have begun serving the addicted population in this county. Just today, in tonight's resolutions, is a peer program with, you know, to help work with the addicted population. And I think we're going to see over the next 2 years an impact from our efforts that and the investments that have been made both by the county and by the state and by other agencies in St. Lawrence County to help get a grip on this severe problem that has done so much damage to so many families and children.
I can say that in my correspondence with other counties, that I would say the opiate issue is definitely a factor, along with mental health, domestic violence, you know, huge increase in ed neglect. But what I can say is there are counties that have higher opiate issues than St. Lawrence County that have decreased the number of their children in care by over half. By over half in the last 5 or 6 years. I mean, from like 1,800 to 600. I mean, it's amazing. So I think that, you know, definitely additional outreach to find out, you know, more of what other counties are doing to work on those numbers is probably the best thing that we can do. I have no doubt that the opiate issues are affecting us. I mean, we probably have to provide, I don't know, 100 to 200 drug tests, you know, a week on you know, families. But, you know, I think it's just another piece of the puzzle of many, many pieces.
Legislator Arkwood.
Thank you, Mr. Chairman. A number like $17 million certainly garners the attention of a lot of people, and as it should. And whether or not Mr. Reagan brings out a good point with the opioid addiction, whatever the reasoning behind little children finding themselves in harm's way like they are, I hope that we all keep in mind that none of those little kids are at fault for the conditions that they live in every day. You know, I want to tip my hat certainly to Cynthia for undertaking this monumental task, but as well, all of her staff and the caseworkers, the ones that are in the trenches that are going in and out of these homes on a daily basis. I don't know if there would be a harder job that I can think of anywhere, anytime. So let's keep the kids in mind and let's save them. Thank you.
Legislator Haggard.
I had a question, Mr. Chairman, about the presentation. Is this something that is something you can email to all of us? Because I have not seen it.
Cynthia, you said the other night at the end of that presentation that the tape was available. How would you propose to let everyone know how they can take a look at that tape, the presentation?
I can talk with our IT department and get the link, and I can send it. I can either send it to you, Mr. Sheridan, or whoever you would prefer me to send it to have it sent out.
The other thing you mentioned, Ms. Chairman, was, excuse me, Ms. Ackerman, is that you said you could do additional presentations similar to the one that you had given to that group the other night.
Correct.
Is that still a possibility as well?
Absolutely. Mm-hmm.
Okay, so we got a couple options. People can look at the tape to see what they missed, or they could have another presentation.
Mm-hmm. You know, and
okay.
If everybody wants to watch the tape and then, you know, ask questions that we can do maybe a second presentation, I'm sure my staff will be 100% on board for that as well.
Okay. Any other discussion? Any other questions of Jenny? All right, we'll have a roll call vote.
Akers?
Yes.
Ray?
Yes.
Haggard?
Yes.
Bianco?
Yes.
Burke?
Yes.
Arquette?
Yes.
Terminelli?
Yes.
Curran?
Yes.
Reagan?
Yes.
Yes.
Lightfoot?
Yes.
Sheridan?
Yes.
Smithers?
Yes.
Denisha?
Yes.
Perkins?
Yes.
15 yes.
Vote carried. Mr. Akers.
Mr. Chairman, I offer a resolution commending the Honorable Greg Story, County Court Judge, for adopting new policies associated with the issuance of pistol license restrictions and the cross-registrations of pistols for members of different households in St. Lawrence County. I wholeheartedly move this resolution.
Seconded by Mr. Denisha. Mr. Lightfoot. Any other seconds? Looks like Mr. Perkins. Rita Kern. Okay, any discussion? Go ahead, Mr. Akers.
As I said, I wholeheartedly endorse this resolution. This is the end of what we've been trying to achieve since 2015. In the body of the resolution, you will notice that there are 10 actions that this body has taken since 2015 to actually get so that the St. Lawrence County residents could enjoy their full constitutional rights. And this is the culmination of it with the election of Judge Story and this resolution. I'm proud to have this go forward.
Any more discussion? No more discussion? All in favor of the resolution?
Aye.
Anyone opposed? Anyone oppose the resolution? Carried. Oh, wait a minute. You see your hand up, Ms. Hager.
Yes, I will abstain from the vote on this resolution for reasons I made clear at the committee meeting.
Okay, abstention noted. So there was one abstention, and the rest of us voted in favor of it, I guess. So the motion's carried. Mr. Akers?
Mr. Chairman, I also wholeheartedly authorize the resolution for authorizing the county attorney to render assistance to the city of Augsburg for the remediation of several properties believed to be environmentally contaminated located within the city of Augsburg. I move this resolution.
Seconded by Mr. Forsyth, Ms. Kern, Mr. Reagan. Any other seconds? Okay. All in favor?
Aye.
Oh, wait, excuse me. No discussion. No discussion. I missed discussion. Let's do that. Any discussion? Mr. Reagan had a discussion.
Yeah. I just would like to thank the county attorney and his staff for their willingness to work on this with the city of Augsburg. And I believe that this will be of great benefit both to the city and to the county over the long term in getting these major shoreline properties back on the tax roll and back into productive uses. And I would also like to thank Ogdensburg City Planning Director Andrea Smith for the efforts that she's made over the past decade to help get these properties to the point where we can move forward on them. So I think it's a terrific example of a city-county cooperative arrangement, and I think we'll see great benefits to everyone and to the economy in the future.
Any further discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution setting a date for a public hearing on proposed local law, number yet to be determined for the year 2021. It'll be titled "A Local Law Reestablishing the St. Lawrence County Multi-Use Recreational Trail System and Establishing a Trail Committee Process." I move this resolution.
Seconded by Mr. Lightfoot, Mr. Arkwit, Mr. Denisha, and Mr. Dan Fay. Any discussion? Oh, excuse me, Harry Smithers as well.
No, I have some questions.
Okay, let's just do that with discussion. Any discussion? Go ahead, Harry.
Yes, I have some questions on this, and I could have asked this before, but I didn't think of them. But between September 15th and May 15th, are vehicles able to use this trail? In the guidelines, it says the permits are valid between May 15th and September 15th. What about the rest of the year, the other 7 months?
And Chairman Arkwit has got his hand up, and he'd like to answer that question for you. Go ahead, Mr. Arkwit.
Thank you, Mr. Chairman. The May 15th to September 15th represents the this summer season when it's open to ATVs and to many of the other userships. The snowmobile season begins December, and then it carries through. These different dates kind of divide up the season because of maintenance reasons, because of natural conditions reasons, seasonal reasoning. So there has to be certain periods of time when the trail is closed for maintenance, but we try very hard to keep it at a minimum of times that the trail isn't used. But from September 15th in the winter time season is primarily used for snowmobiles. We actually have a dog sledder, maybe more than one, that utilizes the trail at times. So it's very diverse in its usership, but it's utilized as much of a 12-month year as possible.
Answer your question there?
Yes.
Mr. Reagan.
Mr. Chairman, could you ask Mr. Arquette how many miles this trail extends across the county?
Do you know the answer to that question, Mr. Arkwit?
I believe I do, but if I could defer to our county attorney so that I don't make a mistake on that number, I'd appreciate that.
All right, go ahead, Steve Button.
Why, thank you. I have only been told anecdotally, and I've been on a fair amount of it, but I guarantee you I have not been on the full amount of it. But what I have been told anecdotally is that with the community connector up in the Brader Falls area, there's approximately 138 miles of multi-use trail system, not including snowmobile trail system, which is approximately another 750 miles of trail throughout the county.
Thank you, sir.
Go ahead, Mr. Ray.
Just to follow up, doesn't this represent one of the largest ATV trails in the Northeast?
Tony, is that true?
Mr. Arquette, if you don't mind, I can respond that it is my understanding that this will represent one of the largest in the Northeast, and definitely it's my understanding the largest in New York State as a countywide sponsored trail system.
And it's my understanding, I'm sorry, Mr. Chair, is it okay if I follow?
Yeah.
When the county was developing this trail, the county planning office worked very closely with the Department of Environmental Conservation to make this a showcase for how an ATV trail can be compatible with the environment, and over the long term, I think many people believe that this trail system is going to put St. Lawrence County on the map as one of the major destinations in the northeastern United States, and as well as southern Canada, as a destination for these riders to come.
Go ahead, Mr. Smithers.
A simple question. Do we have readily available maps of this trail system?
Mr. Arkwood, you can give that answer.
Yes, we do. We have maps online that you can either print off, or we have a number of kiosks across the multi-use system that have that contain maps, physical maps within them, unloading stations, if you will.
Ms. Haggard, go ahead.
Isn't there information about the trail system on the St. Lawrence County Chamber of Commerce website as well? I believe there's quite a bit of information there.
Legislator Garner, let me just note that not only is the map associated with our ATV / multi-use trail system, and I think Legislator Arquette neglected to mention how many horse riders we've got actually out on the trail during the summer. But also our snowmobile trail maps are all up on the St. Lawrence County Chamber of Commerce website as well. So you can find both mapping systems at the Chamber of Commerce.
Good to know.
Mr. Akers.
If I could, I'd like to ask the county attorney about the permits. Are the permits required only for motorized, or will it be required for all hikers, whether on foot or on horse or on bike?
The permitting process is really designed around all utilizers of the trail system. So I noticed a comment, and I think that was probably due to an ambiguity in a statement that I made at the last meeting, but a comment about enforcement mechanisms and really trying to gear towards the ATV utilization of the trail. Obviously, all users are going to be included in the permitting process. But from an enforcement standpoint, it is obviously much easier for us to enforce with respect to those individuals that are utilizing the trail with a heavier usage, horseback riding, ATV utilization. Obviously, those will be easier to enforce with.
So is it definitive now of how these, if I'm taking my family hiking and I got 4 members of my family, is each individual going to have a $10 or $65 sticker?
Everyone except for you, Mr. Akers. I suspect they'll double charge you.
So then I would probably file suit against you because of my tax dollars going to support that trail. So I guess I'm not clear. Is it for motorized, or is it in horses? Some that will have really impact of the trail, or will it actually be hikers also? Is it all?
And Mr. Akers, as I indicated, the primary purpose of the permitting process was designed around the heavy utilizers of the trail system, those that were likely to potentially cause damage, and it was meant to offset the repairs and maintenance associated with those trails. The incidental use of an individual walking on one of the portions of the 138 miles is unlikely to cause the type of maintenance necessary to expend funds to actually cover that type of work. Whereas an ATV, a horseback rider, those folks are more likely to cause necessary maintenance for repairs. So I will tell you that while our local law will be designed towards permitting all utilizers, I find it unlikely that every utilizer, including yourself and your family of four, will show up and purchase a permit to go walking on the trail on occasion, as you have described. I do envision this being more geared towards those individuals that are using either mechanized or horseback means of conveyance on the trail system.
Well, that's about as clear as mud, whether I'm going to get arrested on the trail for walking without a permit. And I think if we're going to have a local law, that this needs to define what the expectation is. Because if the expectation is that everyone is going to have a permit, but yet you are going to, I don't know what means of enforcement, that was going to be the second part of my question. What means of enforcement would it be? Obviously, if you have an ATV on there without a sticker or something much like an inspection sticker or something else carried in the glove box or whatever, that there would be some type of mechanism. And we don't have the resources with the St. Lawrence highway superintendent to actually administer this. So I think if we're going to do a local law, it needs to be clarified. Yeah. And without looking through the 25 or 30 pages, I don't think that is contained within there. So maybe Mr. Arquette could clear it up. I mean, I understand you're going to have erosion with horses. You're going to have erosion with ATVs on the trail. That's going to require more maintenance and whatnot. And but I don't know if those fees for those ATVs would support the maintenance of the trail. So if it's going to be a local law, is everyone going to be required to have this permit?
Mr. Arquette.
Thank you, Mr. Chairman. For starters, this is a resolution that's setting a date for a public hearing. So that's the basis of this resolution. I do understand that that's what the public hearing will outline, or different ideas, opinions, thoughts on how the local law should be interpreted. But getting back to the trail permitting and things, I think that this body of 15 that want to provide a very well-established trail system for the constituents of St. Lawrence County is one of our motivations. But the bigger one is to create revenue. I mean, I'm the chairman of a task force that would like to put a new industry into Medina on the former GM site. Well, we hope for that. Well, what we have for this trail exists. It's not a hope. It's in no way a hope. Our land here is made for this. It's a great opportunity for our residents to enjoy the outdoors. Our residents are spending money, most of them very willfully, that I know, in the two biggest user groups, which are snowmobiling and ATVing, but we welcome all userships. We're still ironing out some of the fine points of this. I think that when this becomes clear and on paper, it will outline, all of the different ramifications for folks that might be wanting to hike or cross-country ski, as opposed to the vast majority of the users that will be on motorized recreation.
Any other discussion? Harry?
Without getting too far into the weeds on this, and this may be a question for another time, but Tony, maybe you know about this. ATVs that are over 1,000 pounds can't be registered, right? And is there anything is this a state issue? How familiar are you with this? I have a friend that has an ATV over 1,000, and he said he has a lot of problems, can't get it registered. What's going on with that?
Well, unfortunate, I'm sorry, Mr. Chairman.
Yes, go ahead, your opponent.
Thank you, Mr. Chairman.
Go ahead.
Just a point of information, Mr. Smithers, we're the only state in the entire continental nation that doesn't allow the registration of UTVs over 1,000 pounds. It's been supported by the New York State Senate since '08. The Assembly unfortunately never saw its way clear to approve a higher weight rating. One of the motivations with this local law, like what's been done in Lewis County, is to raise that weight limitation down the road. So I believe that the UTV class of motorized recreation is likely the most popular right now. There's folks buying them every day, utilizing them. But if there was an opportunity for many of the other folks who don't dare to buy them because they don't have somewhere to ride, this right here may begin rectifying that unfortunate situation. Thank you.
Any other discussion? No more discussion? Okay.
Vote.
All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution appointing a records management officer for St. Lawrence County. I move this resolution.
Seconded by Mr. Smithers. Any discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, if I could, I would like to defer the next resolution to Mr. Denisha, as I am a member of this, of the Northern New York Agricultural Development Program. Mr. Denisha?
Thank you, Mr. Akers. Mr. Chairman, I offer a resolution urging, requesting New York State Legislature provide level funding for the Northern New York Agricultural Development Program fiscal year 2022 state budget at $300,000 and move for its adoption.
Mr. Smithers seconds it, and Mr. Forsythe and Ms. Kern seconds. Any discussion? Mr. Akers?
Thank you, Mr. Denisha, for bringing forth this resolution. For those that are not in the agricultural community, this actually funding provides for agricultural research basically north of the Thruway. Jefferson, Lewis, Clinton County, Essex, also anywhere from alfalfa to grapes. It supports the research that's being done that's necessary for the economic enhancement of the agricultural community here in Northern New York. It's very difficult to get researchers to come from Cornell because of their limited budgets to come forth and do multi-year studies, whether it's on tile drainage, and like I said, grapes, the alfalfa boll weevil, which is something that only that we have here in the North Country. It came off a ship in Oswego. And so I wholeheartedly endorse this for this funding. It's very important economically to the farmers here in Northern New York.
Any further discussion? All in favor?
Aye.
Opposed? Carried.
Mr. Chairman, would you like me to offer the resolution that's on our desk concerning the sewer vacuum at this time? Or does that come later? It's later. Excuse me, it's later. It's coming right up.
This next one here is, it's urging the state of New York to promptly disperse the previous awarded statewide interoperable communications targeted grant funding to St. Lawrence County. This resolution was tabled in February, the board meeting. It had already been voted on a little bit before the resolution appeared on the agenda. So we'll need a motion to remove it from being tabled. Is there a motion to remove this resolution from being tabled? Mr. Akers makes the motion, seconded by Mr. Fay. All in favor, remove well, any discussion?
Aye.
All in favor of removing it?
Aye.
Anyone opposed? Carried. Mr. Akers.
So if you'd like me to read the resolution is urging the state of New York to promptly disperse the previously awarded statewide inoperable communications targeted grant funding to St. Lawrence County and move this resolution.
Seconded by Mr. Fay and Mr. Lightfoot. Any discussion? Yes, go ahead, Mr. Denison.
Mr. Chairman, I don't believe that there's any, that this motion, or resolution needs to go forward, because we drafted this resolution before we were trying to urge the state to get the money to us. The reason it was put on, the resolution was tabled, because we received information that the money would be forthcoming. And to the best of my knowledge, county administrator's knowledge, that the money is indeed forthcoming, so I see no reason to move forward with this resolution.
Go ahead.
So in the mail is one thing, forthcoming is another. When are the expectation that we would receive this?
We have, Mr. Chairman, we have received our letter confirming the $6 million, and the contracts have to be worked through, but our expectation is we can move forward.
But it's not in our account.
Well, it's a reimbursement regardless, so I think the nudge was to move forward with knowing that the number of items incorporated into the $6 million, which is for our tower project for the most part, and conversion to microwave resources, that has come through. That is generally how we would move forward with a letter of confirmation.
Okay, thank you.
Mm-hmm.
All in favor of tabling?
This has been
We'd
removed
actually-
from the table.
To remove, excuse me, I mean removing?
It's been removed.
Okay.
Now we're on the resolution. So there'll be a vote on the resolution, Mr. Chairman.
The resolution's been removed. So we're gonna vote on the resolution to remove it, or
I think
if it's been removed, it's been removed?
I think we would have the vote to remove it, right?
There was a motion made and seconded, and it was a vote
To remove it.
was made to move the resolution from the table to make it active.
Oh, okay.
Back on the floor.
So it's active,
That's
okay.
once you
all right.
vote, when you vote.
So the table resolution is on the floor.
All right.
Mr. Chair.
Seconded.
Yes.
It's been moved in second, so
Or we can move against it.
we would have to, a motion to amend or a motion to remove it.
Or withdraw.
Or the chair.
We need
Yeah.
a motion. We
Yeah.
Withdraw the
If
resolution.
I could, I would make a motion to withdraw this,
There you
this
go.
motion.
Yep.
Any second? Mr. Denise seconds it. All in favor of removing the resolution?
Aye.
Opposed? Carried. That was easy.
Tricky one.
Mr. Akers.
Okay, thank you. So I have a resolution for authorizing the chair to sign a contract with AQ Substance Group Incorporated for the purchase of sewer vacuum equipment for the Northumberland Street Bridge over the Morristown Bay project, bin number 3341380. And I remove this resolution.
You remove it?
Second.
Second. Any discussion? Yes, go ahead, Mr. Forsythe.
Who bears the cost of the 450,000? Don't all speak at once.
Mr. Lightfoot.
Well, when we get recognized, the county has the responsibility of upfronting the money for that. A little over $2 million for this project has been approved by the REDI. If it exceeds that amount, the town of Morristown has gone on record as agreeing to be responsible for any cost overrun. So in the first instance, it is the county that's responsible. We are fronting the money because of the lead time required for this particular piece of equipment to be drawn up with specs and then actually fabricated and put together and shipped up here. We're looking at about an 8 or a 9 month lead time before that happens. So we need this to get passed in order to get the order in for the equipment so that it comes in at the proper time. The monies are handled through the Dormitory Authority of New York. They will be reimbursed to the county. And as I said, if it exceeds the amount that has been approved, the town of Morristown is responsible for that. So what the county will be responsible for is 5% of the total.
So you lost me on the last part. The county is responsible for 5% of the 450,000?
No,
Was the
the whole
450? What was that? I'm sorry?
The whole project, 5% of the cost of the project.
Okay, and the original project was 2 million, and this 450,000 wasn't part of the original project, or it was?
Well, no, it wasn't. Because of the geography there and the geology there, we're forced to go under the river. And because of the type of system that Morristown employs to move that sewage, that waste material, you need pumps. And it's a vacuum system, not a pump system. So the equipment is sort of unique in that it needs to be able, in other words, you can get it down under the river and across the river, but you need another pump on the other side to get it out. And that's what this equipment is for. And it is large enough where it requires a structure in order to protect it. So this came about when it was discovered that there's the original plan to put that under the river didn't include this equipment, and now we find that it is needed because the vacuum system on what would be the south side of the bay isn't sufficient to pump it up from beneath the riverbed.
Okay, so the town of Morristown is met, and they've said they're gonna reimburse, we're gonna upfront this 450,000 cost. They're gonna reimburse us, and there's a resolution that they've passed stating that.
No, we are going to be reimbursed by the Dormitory Authority of New York for up to the amount that was awarded, and I believe it's like $2.2 million. If the cost of the project exceeds $2.2 million, the town of Morristown is responsible for that. Now, and that is after the 5% that the county is responsible for. So of the 2.2 million, the county is responsible for, in the final analysis, 5% of that. Everything else to the county is going to be reimbursed by the Dormitory Authority of the State of New York. If it goes over the $2.2 million, the town is responsible for those extra costs.
Go ahead, Mr. Richter.
If Mr. Chambers is
He's
with
here.
us,
He is.
Mr. Chambers could probably speak to this for Mr. Forsythe's clarification.
Go ahead, Mr. Chambers.
Thank you, Mr. Chairman. Yes, as Mr. Lightfoot was indicating, this equipment is needed for the original project as intended. The original specifications were reviewed by the vacuum pump manufacturer, and they originally indicated that their pump, existing pump, would pull sewage from the other side of the bay. Under further analysis of their equipment, it wasn't sufficient. So now This other vacuum system on the other side of the bay needs to be installed to service over 100 residents over on that area. So it's going to vacuum it to that location, a new location, then pump under the bay to the other existing vacuum system that then takes the sewage to the wastewater treatment plant. So that it is needed for the project to remove the bridge, but was not within the original scope. We will have bids within the next couple months for the entire project, and that's where we will see where the budget truly lies. But we are going to be very close to, we're estimating right now to be very close to the maximum amount allowable through DASNY grant. That's the estimate at this point.
Any further discussion? No further discussion. All in favor?
Aye.
Opposed? Carried.
No.
Forsyth says no.
No.
Motion carried. Mr. Burke, authorizing filling of vacancies. Mr. Burke? We can't hear you. Go ahead, Mr.
Would
Burke.
you mind reading it for me, Mr. Chair? I don't have it in front of me.
Would you mind what?
Reading it.
Reading it for me, I don't have it in front of me.
Let me see if I can find it.
The only thing you have to read is authorizing filling of vacancies.
Okay. Mr. Burke has a resolution authorizing the filling of vacancies. Anybody want to make that motion? I move it. Somebody wants to second it?
I'll move it.
Harry moves it. Who seconds it?
Whatever you need.
Who wants to second it? Mr. Fagg seconds it. Go ahead, Mr. Burke.
Well, I'm not sure what I'm supposed to say other than the fact that all the ones that are in front of you were much needed vacancies that needed to be filled.
Okay. Are you moving those to be filled?
Yes.
Do you want me to read them?
And if you want me to have somebody read them for you?
You don't need to. We don't typically do that.
So any discussion on it?
There we go.
All in favor?
Aye.
Opposed? Carried. Okay, Ms. Kern,
Yes.
you have a resolution?
That already went through, Mr. Chair.
Okay.
She finished up
Done that
first.
already? It's on the end of my agenda. Just cross it off.
Thank you, Mr. Chair.
Yeah. Okay, county administrator's report.
Mr. Chair,
Yeah.
I made a mistake earlier and forgot to recuse myself on the resolution involving the city of Ogdensburg. I recused myself at the committee meeting as a member of the Kiwanis Club, and the county attorney had recommended that just to remove any appearance of impropriety that I do so. So if the record could reflect that recusal, I would appreciate it. Thank you.
Let the record reflect that.
Sure.
Okay. Reflected.
Thank you.
Thank you. Okay, Ruth, do you have a report?
I do. First of all, I wanted to thank you for approving the Records Management Officer. Deputy Clerk Kelly Pearson will be serving in this capacity. as you may recall, Michael Cunningham, who will be looking to retire as Governmental Services Director, has carried that role. And Kelly is going to transition into the Records Management Officer this year. So thank you, Kelly, also for taking that on. Updates related to COVID-19 from a county government perspective. At the end of last week, we had for a couple of weeks a quieter period, and we ended up finishing the week with 4 cases on staff. We were able to arrange cleaning and work with public health in a rapid manner to make sure that any of those exposed could be quarantined and that the folks could be placed in isolation so they can recover and certainly return to work following that. Our state of emergency is scheduled to expire on March 10th. We're reviewing that now, and as many of you are aware and certainly have heard the conversations about increasing capacity on a number of things through the rest of March, we're looking at how we'll proceed with that. I'll look to bring you an update next Monday so that if we're going to extend for one more period of 30 days, we can take a look at that. As you'll recall, the state of emergency provides for 50% office staffing at the county, and with the increase in cases at the end of last week, we'll be monitoring that very closely. As you heard from Dr. McGuire tonight, our vaccine efforts, we did 4 days of distribution in the last 7. If you recall, as a result of a winter storm, we did not receive vaccine the week before. So this was the most clinics held in 1 week since we've started to receive vaccine. We did partner with St. Lawrence Health Systems at the hospital sites this time in Messina and Gouverneur. Very happy to be getting out into the communities. And as mentioned, Ogdensburg, there will be again this week, and the second doses provided at St. Lawrence University. I mentioned to you that we provided our employees with the opportunity to give us some feedback related to COVID-19 safety protocols. And while we're wrapping up the audit associated with the physical or the facility modifications that we've made, I wanted to give you a little bit of feedback related to that. We tried to keep it brief. We asked for open-ended feedback, so we have some of that as well. But we had a participation rate of almost 50% at 360 employees. And overall, our average, if you will, of the 4 questions that were rated was 92.75. So we asked questions like, do you feel members of your department are compliant with mask wearing in the workplace? Do you believe members are practicing social distancing and the protocols? Do you believe cleaning protocols are being followed? And do you believe your direct supervisor enforces mask wearing, cleaning protocols, and social distancing? So our highest percentage was at 96. And we've got some work to do, of course. I'll be bringing you the update on the facility audit that should be complete here shortly, and in the next couple of weeks be able to speak to that. So overall, very encouraged by both our staff's interpretation of our efforts as well as everyone's efforts to make sure as we can prevent COVID-19 from spreading throughout our departments and offices, we're doing our best, and we'll continue to work on that. Also wanted to give you an update on one of our efforts related to our COVID-19 cleaning protocols is our costs associated with having cleaning, deep clean and disinfecting completed in departments. We've had 9 departments cleaned, some of them multiple times, the courts area and one of our lessees out at the Human Services Center. And we're approximating over the course of 3 months and then just starting 10 days into February, where we've spent $49,000 with an average of $1,772 per cleaning. So I think pretty reasonable when we try to look at the impact some folks are dealing with COVID-19. And we have some great partners in making sure we can get those things done in a timely manner to reduce but maintain our operations at the county. So another area I think that's been able to help us reduce the spread of COVID-19. Just back on vaccines, I wanted to mention we are currently one of the top 5 counties in New York State for vaccinations. If you recall, when we began working at this, we took a number of approaches, created a number of partnerships. Certainly the state's site here, which is also opening and increasing their available vaccine options for appointments, has certainly helped with that number. We are very grateful to the running smooth operation over there, to the state for their continued support of that location and all the partners that make it run and run well. Our role getting out into the communities, as I mentioned, tries to address some of the barriers to transportation and some folks' preference as a result of COVID-19 of not leaving their locality. That's helpful also with our partners in transportation and transit. They are continuing to provide the opportunity to provide for route deviation at the request of travelers, as well as VTC, Volunteer Transportation Center, assisting in getting folks from their homes to the sites. So one of the big conversations, and part of the reason the demographics are provided the way that they are for eligibilities, is to make sure that everyone who's interested in getting a vaccine has access to do that. And there's a number of challenges in doing so. St. Lawrence County has 2 members on the Health Equity Task Force that the state has in our region, and we have a dedicated group to identify and remove these barriers, like the transportation example I just provided. So thanks to both Lindsay Newvine and our retired DSS Commissioner Chris Radiz for helping us with that. Did want to just mention to you on the hazard mitigation plan, you've been hearing a little bit about those efforts ramping up. Outreach letters to towns, villages, and the city went out last week. An email communication will be going out this week. They're looking to do their kickoff meeting on March 17th and March 18th. And this week also, Hamilton County has invited some of our staff and also the Soil and Water Conservation District to participate in their planning, and that will take place on Wednesday. Wanted to let you know that the Vacancy Review Committee will be meeting tomorrow at noon. We have 2 legislators participating, and the group will consider 18 vacancies. I wanted just to give you an update also for the most recent update we've looked at through payroll. We currently are at about a 7% vacancy rate. 56 positions are in the process of being filled of our 808. Also, just from a financial perspective for a moment, today we received notice from OCFS. If you recall, throughout the 2020 with the reductions made by state agencies, we looked at a number of highway faced this situation, so social services as well as community services faced withholds, as they're called by the state, at a variety of percentages. Social services just received notice that their 20% withhold is going to be reduced down to 5%. So I've asked Cindy and in turn Colin to take a look at that so that we can get an idea of how much that will mean for St. Lawrence County. We're also finalizing the 2020 totals to seek FEMA reimbursement. That percentage reimbursements change from about 50 to 70 up to 100 for eligible expenses. And we're now looking at capturing all the time that we can, either in the Public Health Call Center, the EOC, when it was open and operating for 6 months. But approximately at this time, we're looking at about $330,000 that we hope to seek eligibility for should it fall in the criteria. And we believe that it does. Also wanted just to give you an update I shared with you last week about the additional information that the City of Ogdensburg has provided. You do have a copy of their restructuring board report in Google Drive under 2020 additional information. That also, I think, has kind of framed the request that's been made with regard to 4 areas, one of which a resolution was passed this evening with regard to waterfront. Also, there's a call, I believe, scheduled on Friday to continue those efforts. There is efforts being made on the dispatch. If you recall, Spillman for a variety of communities in St. Lawrence County was put into place earlier this year. We're proposed some shared transitions. As you may recall, we had the supervisor of dispatch operations retire. So that vacancy process is playing out and getting the leadership into place in the dispatch center. We did receive a couple of weeks ago some information from Ogdensburg relative to timelines that they would propose. So we're looking at that now. And also we had talked in November about putting in place the potential for a pilot, which would be as you may recall, we talked about the village of Potsdam some years ago with regard to sort of getting the idea in place if the call volume could be switched over to test what that might look like. Also, Ogdensburg's been working and gave us an update on their equipment associated with dispatch. They're looking to go operational with that April 1st. So we're hopeful with that equipment investment in place that will make the transition in the pilot conversation an easier one. So we'll keep you updated on that. Mentioned the waterfront to you, the foreclosure process, as we talked about last week, and it seemed the board was interested in looking at arranging the staff to meet with Ogdensburg to go over some of the options, which would include foreclosures, following the collection of taxes, collections of taxes as well as foreclosures, or potentially leaving it as is. So those are some options I think that we can look at. And then the fourth one provided to us from Ogdensburg was also the hazardous materials response team. We had originally settled that contract November 7th. We received notice here just a little bit ago about removing our decontamination trailer. So that has been relocated. And the entry trailer has also been relocated, so inventory can be done. We're also talking about the importance of training. I think that getting names for the team members is going to be important. Looking around to make sure we have a good team in place is also important. And council reviewing their shared concerns. We'll have the attorneys take a look at the revisions that Ogdensburg sent back and be able to go over what that means for the hazardous materials response team. And then there were 3 other items that were raised as additional analysis options. Those included Sheriff's Office, Ogdensburg PD combination, human resources and payroll options, as well as consideration for health insurance. There's not been any meetings or conversations about these at this time. A few years ago, some of you may recall, we looked at the health insurance consortium. We actually looked at pulling in all the towns and villages in the county and the city to determine if it would make sense, a bigger pool, smaller cost. At that time, the law required a $5 million reserve, and that became a stumbling block for us as well as the local municipalities. We could potentially look at if that has changed and or what a combination between any of the municipalities might do to reduce that overall contribution. So those are the areas I believe that were submitted by Ogdensburg to take a look at this time. Are there any questions?
So we mentioned the decontamination trailer. Who made that request and why?
I believe that the city manager made the request as a result of not having adequate staff at this time.
Thank you.
Mr. Smithers.
Yeah, Ruth, on these requests from the city of Ogdensburg, do you anticipate reviewing these? Is it you or who's involved in doing that? Is it a committee of legislators or who will be reviewing all of these?
Well, I think there's a number of options. Ultimately, it certainly is the Board of Legislators' determination if, in fact, any of these services will be provided. A number of data points have to be pulled together, both from the city side as well as the county, and the staff can do that. You know, where it's applicable, for example, on foreclosures, that's a conversation, as we talked about a little bit last week, between the Treasurer's Office, County Attorney's Office, and Real Property. Obviously, payroll and HR functions would be gathering data and working with those departments, both to determine the impact on the county side of operations, as well as understand the impact for the city of not providing those services independently any longer.
Mr. Akers.
Bruce, do we provide HR or payroll, or are we involved in any healthcare situations with any other municipalities in St. Lawrence County?
No, currently the only provision we have for municipalities is for civil service, and we took that over for the city of Ogdensburg, I believe in 2017, but I'd have to, maybe 18. So a few years ago now.
Thank you.
Mr. Smithers.
How would review of these involve reviewing the effects on the residents of the city of Ogdensburg? Would they be able to have any participation on how some of these changes would affect them? Would we get any citizen input as far as that goes?
I'm not sure what the city has planned at this time. I think that our county attorney was going to look in what may require, and he's here with us, what may require in some situations a referendum, what may not, where the latitude may be for this board to determine how they want to move forward, but also if the services are provided by the city now and they transition to the county, what that timeline also would look like.
Mr. Forsyth.
Thank you, Mr. Chair. Ruth, ballpark, by the initiatives the city manager has proposed, any idea of timeline? How long do you think this will take to get all the information gathered? What do you, conservative?
You mean
and depending on how far we want to go with it.
Well, the immediate action items are all underway. And I think that those, one, a resolution was passed tonight. And so that will get underway immediately. Property tax foreclosure, that's a rather complex process. And it's not as though currently our processes are in tandem or simultaneous. They are on very different calendars and have very different requirements. So that one may be quite a bit longer to make a transition if that's what the board would like to do. The hazardous material response team, I think that could be pulled together. I think potentially if Ogdensburg doesn't have necessarily the resources from any of the perspectives, we can also look around at the consortium who's interested in providing us equipment and the state who's interested in providing us training. So that one I think would be on the state schedule related to COVID for training. But as far as equipment, I think that probably would be short term within the next quarter or two, could be worked out. And then police dispatching, I think once we know that their equipment's up and running, I have the staff looking at what a revised timeline would look like. And so we could bring sort of the data piece back to the board to make a determination on.
Just to follow up, Mr. Chair.
Good.
Ruth, would you believe a year would give you the time frame to
make
everything?
A recommendation?
Yeah.
I do.
Okay, thank you.
Mr. Reagan.
Mr. Chair, I just want to thank Ruth and the department heads that she's working with for their great effort to work with the city of Ogdensburg on these issues. I know that when all is said and done, we may not be able to do all of them on the lists that are being proposed. But I think there's opportunities, as we've shown earlier tonight, to do some of them and to streamline services and in some cases improve services to the people of the county and the people of the city, especially since the state of New York has offered financial assistance to help with some of these initiatives. And I think that, you know, we can be a model for the rest of the state on how the county and municipalities can work together to make things better for the people of both the city and the county in this case. And I would just like to, you know, reinforce, you know, how pleased I am that you and the department heads are open to these ideas and are working with the city. And I know that you have the interests of the county and the city uppermost in your mind, and that's a great comfort. The one thought I would just like to toss in the mix, which, you know, may not be practical, the next auction that the county does on tax foreclosed property, the city has a great number of properties that they have taken ownership of and that they've been unable to sell at their auctions. And our treasurer and our auction has an amazing record of selling properties. And it would seem that for those properties that the city has already taken ownership of and has signs on right as we speak saying for sale, that they could add those properties to the auction, pay the auctioneer their percentage of any sales that occur. And as we saw in the most recent auction that the county did, every property had a bid. And, you know, in that one fell swoop, we could very well get a lot of properties back on the tax roll and back into productive uses and paying county taxes again. So I would just ask that you guys look at that as an interim option as the entire foreclosure study continues.
Sure.
Mr. Lightfoot.
in response to Mr. Reagan, I would say that an excellent program to take a look at in furtherance of that is the relationship that the county of Oswego has with the city of Oswego for that very thing. And that has been in effect in Oswego County for some time. There is an agreement between the two that allows for such a thing. So that is something that I think, at least at this point and at first glance, that I'd be willing to support.
Mr. Akers.
I'm quite familiar with Auctions International. I participate, I bid on product. That's a service that the city of Ogdensburg could attain on their own without any interdiction at all with the county. That could be arranged at any particular time. It can be no cost to the city. The Auctions International, they do that for other municipalities now. Those properties appear on the Auction International website. So that is something that can be done on their own.
But my point is that the, Mr. Chairman.
Go ahead.
Okay. Is that our countywide auction that we hold is very well publicized, is very well attended, both in person and on the internet, although currently the most recent one was on the internet. And I think that, you know, working with the city and having their properties as part of that auction would help them get the maximum number of bids and participation in it. So, you know, I know they could make use of that, but I think that when you've got something successful, something that's working, that's the kind of program that you want to be involved in.
Any other discussion?
I just have two other items if there's not any. I think Mrs. Haggard has her hand up.
Go ahead, Ms. Haggard.
Other than the auction and the property, is this sharing of services something that other municipalities would have an opportunity to participate in? Or is this specifically because Ogdensburg asked us, or is this something where we could reach out to our municipalities and see if they want to participate in any of this?
If I could answer that, Mr. Chair.
Yes, go ahead.
So we have the ability through the shared services panel to have those types of conversations. I believe that the group will be pulled back together. The interest is in doing that in March to be able to have that type of dialogue. And it isn't always between the county and a municipality. Sometimes it's between other municipalities, either adjacent or like services. So it is wide open in that regard for those types of ideas. And the state's willing in that interest for situations that savings can be demonstrated to provide some funding to assist with that.
Any other questions? Go ahead.
No questions, but a comment. I'm just going to sit here and keep my mouth shut. I'm not going to. On the shared services, I know how important the shared services are. There are very few towns in St. Lawrence County, northern New York, that could exist without shared services of some description. I know the towns work together, hauling blacktop, hauling sand, helping one another pave. You know, there were some towns that worked together this winter during COVID. There was a couple towns that didn't have none of their crews were able to work. So bordering towns came in and helped. So it's a way of life. And I know a couple of years ago, there were some shared services group meetings between towns. And I think any place that we've got the ability to share services, I think we should, but I want to stress shared services. I want to stress that. I will not support Ogdensburg just transferring the cost of something to St. Lawrence County. If they're interested, I think there's some places that we can work together, and I think there's places we should work together. But as far as just transferring the cost of something to the county, that's not shared services. That's dumping and running.
Mr. Ray.
And I think that the correspondence shows that the city is offering to work with the city or with the county on helping to share costs as well as services. So I think that Mr. Denish's point is being addressed, and I think that Ruth and her department heads will be looking closely at those kinds of issues, and also looking to the state of New York, which has said this is a priority for us, and we will help fund some of these kinds of cooperative ventures.
Mr. Tony Arkwood.
Thank you, Mr. Chairman. You know, we've been, I think many of us been politically correct tonight and kind, if you will, in talking about shared services and, you know, mutual agreements and things like that. I think that the elephant in the room is the fact that we went through a lengthy attempted negotiation with Ogdensburg on sales tax distribution. They refused to come to the table after, after offering them up an additional year of increased sales tax revenue that they shouldn't have been getting. And this is simply retaliation. This isn't any attempt in any way to share services. It's simply retaliation. I'm not very interested in, I'm interested in doing what we as a county are obligated to do, but I'm not interested in any way in potentially offering up shared services that we're not obligated to do to a city that had every opportunity in the world to do the best thing for the people, come to the negotiating table over sales tax distribution, and come out of it with the best deal that you could for the people you represent. Thank you.
Any other comments, discussion?
Mrs. Haggard has her hand up.
Go ahead, Ms. Haggard.
I had trouble earlier, Mr. Chair, differentiating between my two good friends, Mr. Lightfoot and Mr. Denisha. I believe Mr. Denisha made some comments before Mr. Reagan. Is that correct?
Yes.
Okay.
Yes.
I support an agreement to Mr. Denisha's comments. I agree with him. Thank you.
Any other discussion? Okay.
I had two more items.
Go ahead, Ruth.
Just wanted to mention, as a part of the new website, we are in the business of developing an intranet. So as part of that, it will be a portal to communicate for county employees more effectively. And in the next few weeks and months, we hope to introduce this exciting new endeavor. It's called My SLC. So it'll be a place where our contracts can live, our policies, our forms, all of that, as well as sharing exciting options and programs that are going on in departments. I think because everyone's so busy and because our work is so important, we don't get a chance to share between one another. But when people know you work for the county, they ask you about all kinds of things. So I think this is a way to better inform and also to share some good information around to our county departments, some of which are in other communities. So they don't have the opportunity to come to the Canton campus and see each other. So I think this will be a really good tool for us. And also just wanted to give you an update related to January visits to the website were 51,000. And in December, we're 46,000. So certainly the pandemic has increased the visits to the COVID center and getting good information and being a good, reliable source of information. But also, I think that's been coupled by an excellent website that we've rolled out last summer. Certainly a complicated time to move in that direction, but really proud of all the staff who've done that and all of the departments who are going to keep that current living information so that people can come to the county website to get the information that they need. And then lastly, I wanted to mention that this Friday is recognized as Employee Appreciation Day. So I just want to take the opportunity to thank all of our staff, encourage and appreciate everything that they do. Certainly the pandemic has complicated things in ways we could never have imagined, but everyone's risen to the occasion, and certainly not only celebrate this week, but throughout the year. But it's always nice to have a reminder of how important our employees are. That's all I have.
Thank you. Any old or new business? Yes, go ahead, Mr. Draper.
So I meant to follow up on the county administrators. It is old business. Ruth, could you tell us, is the DMV open for the drive-through?
Yes, the DMV is open, and I believe they're taking plates back and registrations.
Okay. Nothing else, or just those two items?
I believe they're working on it. But yeah, they've had steady business. Sandy visited with us last week at the department head meeting, letting us know that they're trying to make sure we can serve St. Lawrence County residents first, and that the transactions they're able to provide, I believe, are limited to those two at this time.
Okay, thank you very much.
You're welcome.
That's great news for the.
It is great news.
Mr. Lightfoot.
No, I'm sorry. I didn't mean to interrupt.
Oh,
that's okay. If I could, Mr. Chairman, members of the Youth Advisory Committee have been reaching out to me with their concerns about the ethic applications. And we heard last Monday about the EMC, Environmental Management Council's concerns also. And I have an interest in putting forth a resolution exempting these individuals, these advisory groups, for as many as we can from having to do this application. They are not policy boards. They don't create legislation that they can benefit from. They actually are just that, they're advisory. And I spoke to Mr. Button. I don't know if Mr. Button, he said that he would comment tonight if he would.
Go ahead, Mr. Button.
Thank you. I did have occasion following last Monday's meeting and following the prompting from Legislator Terminelli to reach out to the Board of Ethics. As I indicated last week, following an audit that was prepared by the New York State Comptroller, it interpreted a vague provision within the local ethics law that seemed to suggest that all of these boards, advisory committees, should be included. One of the things under the local law that can occur is that the Board of Ethics has the ability to grant annual exemptions associated with the performance under the local law. I did present to them Legislator Terminelli's concerns. I also presented to them Legislator Akers' concerns regarding these non-policy making advisory committees or boards, councils. And there has been at least an expressed interest by a majority of the board to issue out an annual exemption for those non-policy making individuals from having to file the financial disclosure statement. But as I think I mentioned, these are temporal in nature. They are limited essentially to an annual exemption. The only way to permanently modify this would be through a modification of the local law. Now, our financial disclosure statements are due by March 31st. Obviously, a short-term solution is this type of exemption that will have to occur with a formal action of the Board of Ethics. But I would recommend, if the Board of Legislators is interested in a long-term solution associated with this, when the Board of Ethics brings forward suggestions after a review of the ethics local law later on during the course of the year, we could go ahead and include this as the type of modification for a permanent change to the local ethics law, so that these types of groups are forever exempted from having to file as long as they are in a non-policy making position.
I agree that it's a great idea that we move ahead with the idea of doing the long-term exemptions from my standpoint. And Mr. Smithers?
So my question would be then, tonight, do we need to put forth a resolution to, in the meantime, until we get a long-term one, to put that forward so that we can have no worry about that in the meantime, until we get that done?
So I think that we are, Mr.
County Attorney.
Yeah, I defer to the county attorney on this matter.
Go ahead, Mr.
Mr. Smithers, Mr. Akers, actually, the Board of Legislators by resolution, I'm not sure legally could forgive the responsibility to go ahead and file the financial disclosure statement. You obviously have the power through the local law amendment process to modify it, but just by mere resolution, a mere resolution wouldn't supersede. Interestingly, though, as I indicated, the Board of Ethics does have the legal authority on an annual basis to pass exemptions. So for tonight, the Board of Legislators doesn't need to do anything. You can sit pat and wait until later on during the course of the year when the Board of Ethics can bring recommendations for modifications to local law. This month, the Board of Ethics can move forward itself and pass exemptions for these non-policy makers. So that'll take care of the short-term problem by the Board of Ethics, preparing and providing the exemptions, and the long-term problem can be resolved by the Board of Legislators later on during the course of the year.
Ms. Terminelli.
Thank you, Mr. Chairman. In addition to that, I would recommend, I reached out to the members of both the Youth Advisory Board and the Environmental Management Council, just to let them know that my recommendation would be to hold off on completing the financial disclosures, being that they're not due until the 31st, to give the Ethics Board time to file their annual, that they don't have to do it this year. So as liaisons to boards, that would be probably a good recommendation to let those members know that instead, in lieu of panicking, just to hold off.
Thank you. Any more? Ruth?
Not on mine. I'm good. Old
Go
new
ahead.
business, I think.
So tonight we approved the resolution, encouraging the judge to move ahead. What will be the proper procedure for those that have pistol licenses now to get those restrictions removed? And then not only that, I think for publication that it should be included on the county website for the process, so that we're not inundated with telephone calls and to the county clerk's office and to whoever. So if you could address that, or Mr. Button, whichever.
County attorney could speak to the process, and certainly we're happy to put that information up on the website so that the public has an easy time finding that. And as you suggest, don't have to bombard with phone calls. Steve?
I'd be more than happy to address it. During the course of a meeting with the judge, the sheriff, and the county clerk, it was identified that the county clerk has actually already prepared a form to be put together by the various pistol licensees. That form, it is my understanding, is already available online through the clerk's office. So it's my understanding that if you download that form, print it off, prepare it, mail it back to the clerk's office, that form will be sent to the county court judge for review and removal of the restriction.
Excellent.
Mr. Forsyth.
I just went through the process. There's an amendment form. I think it's a $4 or $5 fee. You put a self-addressed stamped envelope in your copy of your pistol permit that goes to the county clerk. Took about a week. Very well done and very user-friendly. And I encourage everyone to take advantage of it because it worked quite well.
Any other discussions? Questions? So, is that, Mr. Burke, your hand up?
Are you, what are you under, Chair? Old business, new business?
No, we just finished off on Ruth's report with a follow-up question.
Okay.
Mr. Akers, but now we're ready to go to old new business. Now, is there any old business to come before the board? Go ahead, Mr. Burke, go ahead.
Well, not sure whether it's old or new business, but I wanted to, if I could, ask Cindy another question. It wasn't related to the topic at hand. It wasn't related to foster care. Do you have a problem if I direct the question to her?
Go ahead, Mr. Burke.
Cindy, there were concerns expressed on the promptness and follow through of the December 7th resolution that had to do with the agreement with the county attorney and support, the support contract. And I think from what I gathered, at least reading the emails, it seemed that there was, the concern was that, there was a, what they considered a what we considered, or some of us considered a directive on December 7th. And then it seemed to take a while for the process to go through, and still hasn't gone through. Just wanted to give you a chance to maybe enlighten us a little bit on that, Cindy, if you would.
Sure. So I did receive the correspondence, and there does seem to be a concern that I have failed to follow a board directive, and that in regards to the support contract between the Department of Social Services and the county attorney, that no actions were taken between the timeframe of December 7th, when the resolution was brought forth and voted on, through January 29th, 2021. So first I want to clarify that I do not have the authority to sign a contract between the Department of Social Services and the county attorney in regards to child support enforcement without the prior approval of the Office of Temporary and Disability Assistance. I cannot do that. The contract must be submitted through them prior to me signing any contract. Has to be approved. So there actually was a lot of correspondence. I actually kind of did a time frame, which came up to about at least 21 or 22 correspondences, but to not go through all of that, I just want to say that, prior to the resolution for the contract, even going through on December 7th, I had already reached out on November 11th to Jefferson County to seek a copy of their contract, as they do contract with their county attorney for their child support enforcement. So I thought that would be one of the best, at least examples to get on how we would proceed with this contract if we chose to go through with this. So the next day I did submit that to the county administrator, which was then sent to Steve Button, the county attorney. And I received the first draft back from them on December 31st. On that first draft, it all comes down to the office, I say the Office of Temporary Disability Assistance, it's OTDA, so I'll refer to OTDA for the next minute. The Office of OTDA looks for the most cost-effective way for these contracts to be completed. And there's been a lot of concern over the past, especially through the counties, working together on these contracts. They actually call it padding of the hourly rate. So there's been a, kind of going through all this. The first draft that I received back was an hourly rate of $98, and I believe it was like $98 and some change. So with that, I talked to my team, because I do that. I bring my team into everything that we work on. So I brought the support coordinator in. I brought Colin Mackey, our finance manager, and we discussed the contract and David Haggard and how we would move forward. So we were all a little concerned about the rate. So I brought that back to the county administrator and said, we might need to kind of look at this a little bit because we're a little worried it's not going to go through. Please note that the Jefferson County contract is $52 and some change an hour. With that contract in Jefferson County, they also assume the responsibility of the paperwork. There's a lot of paperwork that goes on behind the scenes. So the contract that was brought forth by the county attorney for St. Lawrence had that part removed. So the hourly rate was for the support magistrate, and they're not even doing face-to-face. It's via Zoom. So that's kind of how it works. So there were concerns with that. So the contract came back to me again on January 15th with a rate of $75 an hour. So I brought that back to my team the next day and we talked about it. We were a little concerned about the hourly rate at that point, but nevertheless, we decided at this point, let's just go through the office, go through OTDA so that we can find out more about how to proceed with this because we didn't want it to take any longer. We'll talk with them about it. So when we had that conversation, which actually got into, I think the first conversation that we had with OTDA was getting into February. We had a Zoom scheduled for February 10th, which got canceled. And then we ended up having a Zoom on the 17th. The reason why the first Zoom was canceled is because Brian Wooten, who oversees that part of OTDA, he actually writes the memorandums, had sent me an email saying, hey, I saw the contract. I really want you guys to read over this memorandum, which, I think by default, and kind of justifies kind of the length of some of this time is that being the first time for St. Lawrence County to go into a potential contract with a county attorney, nobody was aware of this memorandum and all of the details of the memorandum. So with that, we found out that there was a worksheet, I call it attachment 4, where the county attorney would then have to calculate their hourly rate. That has to be submitted prior to the approval of any contract. So then we got in discussion about, okay, we can't move forward with a contract until this attachment 4 is filled out and submitted. So I did have discussion, about that. I think in my discussion with Ruth today that there might have been some concern, or I guess I should say confusion of who was to fill out that attachment 4. So I think that's kind of what's got us to where we are today. But I just want to clarify that there were a lot of correspondence going back and forth. This was not pushed off in any way, shape, or form. I think that professionally, we worked towards finding what the most cost-effective way was to do this. I did see clarification on the reimbursement for the contract. I guess there was some question as to why the county attorney's office wouldn't receive the same 81% reimbursement as social services. But the response, and I believe that Ruth and Steve has that response as well. I did CC them in when I was corresponding with Brian Wooten, that any outside contract, regardless, as long as it's outside of the Department of Social Services, is the 66%. So that, that does stand. So that's kind of where we are today. But I just want to assure that, in no way, shape, or form was I, not following a board directive. Sometimes these things take time, and I think as we're learning and moving forward, definitely was some information that we didn't have. I think my only concern, to myself was, basically kind of the way this was addressed. I don't know why somebody didn't just ask me kind of what was going on. I definitely would have presented the information as I knew it to this point. So I'm kind of hoping moving forward that, this type of thing isn't going to happen again in the future.
Just a follow-up if I could.
Go ahead, Mr. Burke.
I guess, what I would say, I mean, I read the emails, of course, and, and, as we look at the challenges that DSS faces, the primary objective being protecting children and assuring for their safety in a nurturing environment, and also the service to the families and all the people who all the people who are in need in our county. I guess it would certainly be my desire that we empower Cindy to do whatever she needs to do to achieve that goal, and trust and her that she has the certainly has the capacity to take that task on. I don't know. I get a little uncomfortable when it looks like we're talking about turf and responsiveness to our directives when there are so many burning issues with social services. And again, I'd like to think that we could keep the big issues in our sight and follow through on them.
Yes, Mr. Akers.
So I'll respond. Initially, when I brought this up at the finance meeting, I was unaware, from not looking at the heading, that it wasn't sent to everyone. Instead, it was sent to Chairman Sheridan, Vice Chairman Denisha, and then Mr. Lightfoot, Ms. Curran, and myself. And so when I started to ask questions, I mean, the very first question I asked about was why the delay, and you said, we'd like to keep our options open. And it actually really stunned me. And then when actually Mr. Arquette put his hand up asking questions like we didn't receive the email, I dropped the questioning. And it certainly seemed like to me that there were some ambiguities in the letter that we all received, that the people that I mentioned received this. And I think, Cynthia, what it really goes back to is right back from the very beginning, we don't know each other. I don't know you. You don't know me. I take my job pretty seriously. I know you do also. But this whole issue of support was precipitated by DSS Legal sending a note to the judge that the county attorney was going to be taking over this matter. And then actually in a vacancy committee, which I participated in, we talked about an intern that was had taken the bar exam, that we were looking to come back here. And that intern, when we talked about it in the vacancy committee, had nothing to do with about support cases. It had to do with the high cost individuals that we have, particularly foster care and institutionalization. We talked about this individual coming back to doing that. But yet, when the matter came up in December 7th, you pitched the idea that this individual would actually be doing support cases. And I called you on that because what you said in the vacancy committee that I witnessed and I participated in that discussion had nothing to do with that intern. So I don't know what had happened, but it raised questions for me as to what your motives were or whatever. And so when I saw this letter and that the board action, which was a contentious vote and much discussion, that was decided on December 7th to move ahead with the county attorney doing support, it really threw me off that the application appeared to be, according to Mr. Button's letter, was never submitted until January 29th, fully almost 2 months, lacking a week of actually what the board had moved ahead in that action. So when you said, and I believe your words were, we'd like to keep our options open, I didn't know who we was. We'd have to look back at the tape. That's what I remember, but it may not. And I guess, so that raised flags for me, going back to the history about the discussion about the vacancy and the individual who was taking the bar exam. And so maybe we have Mr. Button there. Maybe Mr. Button could talk about his remarks in the letter. I felt that I apologized to the board that they had not received the email and I dropped questioning, and I felt obligated to send that email on for the rest of the legislators to see that. So I defer to Mr. Button if you would.
I would just like to comment first that I don't recall saying initially that I keep my options open to that. I might have said that after I had the discussion of everything else that was going on. So I don't recall, basically willy-nilly saying that, oh, we just want to keep our options open. This has been a situation that I have worked diligently on. I've spent a lot of time on this when I've had a lot of other things going on. So this is something that I as well have taken very seriously, but I also take very seriously what this department is spending and what we can or cannot spend. So when I was asked to look at what is most cost effective, that's what I did with my team. So when I decided, when the discussion came on with Brian Wooten and kind of what was going on, my team and myself decided to look at, okay, so if this isn't going to work out, what else do we have? We have to keep our options open. We have to move forward, with something. And I think in one of my emails to, I think Ruth and Steve were that, support has to be taken care of, whether it's the Department of Social Services or whether it's the county attorney. Whatever is most cost effective for the department is what is what would be chosen. I told them at that time that I am still open to any options.
Well, if I can respond, the ambiguity of how support.
Mr. Chairman, point of order.
There is no point of order unless parliamentary procedure is being violated. There is no point of order.
Mr. Chairman, we're talking this is executive session. We've moved into executive session conversation here. We're talking about specific employees. That should not be happening in the general public. We're talking about specific employees and their actions. This is executive session material.
Well,
it didn't start out that way, but it didn't start out that way.
If Mr. Hardwick's response is correct, ask Mr. Button there if we need to put this off until executive session. Get him to rule on that. See if
Mr. Button, do you want to make a rule on this conversation?
I will tell you what the Committee on Open Government has told me. The Committee on Open Government has told me that executive session is not a mandate. It allows for governing bodies to move into private discussion regarding certain designated items within the open meetings law, but it is not a mandate. Now, I appreciate Mr. Arquette's concern. And if we are going to move into discussing specific employees, it has been this board's practice to have those discussions in private, in executive session, when speaking about the prospect of discipline or employment history, or talking about the prospect of promotion or demotion. Those items have always been held in executive session.
I don't think anyone's talking about demotion or discipline in these comments that Mr. Akers has been making. He's merely making some points. We do have an opportunity to go into executive session here later on this evening, so.
Two people with their hands up.
Mr. Arquette, go ahead.
Thank you, Mr. Chairman. And with 100% respect for Mr. Button's comment, personnel is one of the 4 items listed for executive session. We are talking about numerous personnel members and actions that they've taken. We're talking about something that has gone wrong in a department could potentially lead to discipline, as we're talking about actions taken in open session. I'm just trying to protect our employees. I'm not trying to stop a worthy conversation. I'm trying to protect the sanctity of executive session and the staff that works for us diligently when some of the people that are being discussed are in no way here to defend themselves in any way.
Ms. Haggard.
I want to back this up a little ways because I'm still stuck on this thing where select people get emails and other people don't get them. And I know there's some decision that was made about the hierarchy. And as Ms. Legislator Akers pointed out, we were caught flat-footed, not knowing what you were talking about because we were not privy to whatever. I don't know whether it came from the county attorney's office or the Mrs. Doyle's office, but could somebody shed some light, thank you, Mr. Button, on how you chose who you were going to send this to originally?
Certainly. Originally on December 7th, when the resolution was passed associated with the conveyance of the support matters to my office, during the discussion on the floor associated with that, there was a request. Actually, I'm not sure that it was a request. It was more like a directive that within 90 to 120 days, originally it started out, if I recall correctly, 180 days out from the date of the transfer, that I would have to prepare a report associated with the activities of the support matters to present to the board. At the approximately, I want to say, actually, last Monday, I had a discussion with Cindy. During the course of the discussion, I actually indicated to Cindy that it was my intention to update the chairs at that point, that I did not have the pass off of the support matters, that I did not believe that I would be able to respond in the manner that I was supposed to. Cindy indicated to me during the course of the conversation that she felt like she had already responded by having communicated to Mr. Lightfoot with respect to questioning in a prior board meeting, that it would be unnecessary for me to send that off. I indicated that I still intended to send it off. The report that was sent to the chair, the vice chair, and the 3 committee chairs. Those individuals that are identified as the responsive individuals for any report that's provided to the board. I didn't have any problem with it going to the rest of the board members at all, but that's why those 5 individuals plus the county administrator were selected for the report, or really lack thereof, that was sent to them. As you know, having communicated with me several times, I don't send all of my emails to every single member on every single issue associated with the board. If there is an issue specific to a member, I will send it to them. If there is an issue specific to a committee, I will send it to the committee chair plus the legislator that raised it. But this was an issue where I wasn't actually entirely sure which committee or board I was supposed to respond to, so I responded to the chairs of each.
Just, if I may.
Yes, go ahead, Ms. Hager.
Thank you very much, Mr. Chair. We all voted on that resolution that it be looked into. So I was a little surprised when we weren't all apprised of the situation. The other thing I was going to point out is Ms. Ackerman doesn't report to this board. She reports to the state.
That's incorrect, Mrs. Haggard.
Really?
It is.
That's not what I've understood. And I think that we need to take a real strong look at that, because as we sit here and speak to her in the manner that I find offensive in open session, I think we need to understand she is the Commissioner of Social Services, and she's appointed by the board for a 5-year period. And I mean, she has people in the state that she reports to, even though we appointed her. So I guess that's a matter that can be taken up at another time. But I agree with Legislator Wet and others who have said this. It's disgraceful that we're doing this to this individual in open session.
Legislator Haggard, just so that you're aware, Social Services Law, Section 66, 65, and 116 actually apply the authority of this board over the commissioner as well as the activities of the Department of Social Services.
Mr. Smithers.
Well, I'd like to thank you for your comments, because I found them enlightening. There certainly is confusion, and I don't want to micromanage for sure. We're just overseers, so that did help, I think, answer some questions in the information that you provided. So I thank you for that. And if we do want to continue this, I would probably agree that I'm a little uncomfortable doing it in open session for the public to hear.
I would just, go ahead, Mr. Forsythe.
I guess my question is, and Ms. Haggard, I wasn't privy to a lot of what you're talking about either, so I get you. Are we still moving forward with the county attorney taking over support, or has that been shifted? Where are we at? I guess that's my question for Cynthia. Where are we at?
in order for us to move forward with a contract between the Department of Social Services and the county attorney for support, attachment 4 of the memorandum that I sent through will need to be completed. Upon the completion of that, it will need to be submitted to the Office of Temporary Disability Assistance, and they will then either approve or disapprove the contract. Then the contract can be signed.
So just to follow up, Mr. Chair, so we're in that process now. Are we in that process, or has it?
Rick Perkins.
Rick Perkins?
Yes, I was just wondering, Ms. Ackerman, if you could tell me, or Mr. Button, what would the process be of the county attorney taking over the entire legal services? Would that be a better issue? You know, would that save some of these issues that we're talking about?
I think right now the legal department in the Department of Social Services is amazing. I think that you have people out there that are dedicated to what they're doing. They are dedicated to providing services to children. They go in there every day and work with, you know, in difficult situations in the courtroom. And I think that it would be detrimental to the department to remove that right now. They have built great relationships with the caseworkers. You know, everything seems to be moving as smooth as it can, despite the enormous amount of paperwork that we have, the enormous amount of perm reviews that we have, the enormous amount of TPRs that we have, Articles 10s, 1034s and all that. I really believe that that would not be in the best interest of the department at this time.
I don't disagree that the you have some good help there. I'm not saying that. I'm just asking about the county attorney taking over, the county attorney's office taking all of the legal services over, just being in charge of it. Maybe Mr. Button could speak to that.
Yeah, actually, I was going to ask you to clarify what exactly we're proposing, but it sounds like what you're proposing is a hypothetical in which my office would act as supervisor associated with the legal unit over in DSS. Is that correct?
That is it.
It is theoretically possible. I know that there are a significant number of counties within the state in which the county attorney actually performs the full legal oversight and provides the full legal services. What we have here in St. Lawrence County is known as the Social Services Law, Section 66, Legal Office. Pursuant to Social Services Law, Section 66, the Board of Legislators can empower the Commissioner of the Department of Social Services to hire additional employees to include attorneys. In 1984, this board did just that. Originally, they were assistant county attorneys and part-time county attorneys. But the first permanent DSS attorney was, I believe, created in 1984. And since then, obviously, we've added 4 more. So there's 5 over there, plus the staff members. I do know that there are a number of counties that opted not to go the Social Services Law Section 66 route. I know there are some counties that have a hybrid model where they've got assistant county attorneys placed inside DSS to perform the legal function while the county attorney unit stays separated. Schenectady County comes to mind. I am actually aware that they have a county attorney, a deputy county attorney that are separated off from their DSS assistant county attorneys. And those assistant county attorneys still operate within the building of DSS. So very similar setup to what we have. There are some advantages to doing that. Obviously, one of the advantages is that you combine forces, you increase the number of attorneys that you have available to perform legal functions for the Department of Social Services and vice versa. Those attorneys are no longer limited to only performing DSS functions. They can also perform civil litigation functions. They can perform functions that are associated with foreclosures, with workers' compensation, with FOIL, with a number of different activities. It also, as an advantage, theoretically opens up the salary of anyone associated in the county attorney's office with DSS function for reimbursement through OTDA. That was, I think, something that Cindy raised in the discussion earlier was the reimbursement rate. One of the things that OTDA identified, at least in one of the emails that I saw that had been provided to us, I think by Cindy, was that OTDA identifies any outside purchase of services or purchase of services contract is subject to a lower reimbursement rate, 66%. But any function that's performed internal is an 81% rate. So that increased rate, all of a sudden, the county attorney's office becomes eligible for that when all of the activity is essentially performed internally. I still have to research that a little bit because there are other county attorneys that believe that because DSS is technically a part of the county and under county leadership, that the county attorney's office is in fact eligible for that 81% rate. But I'm not entirely sure, so I'd have to double check that. There are some massive drawbacks to what they're proposing now. I'm already carrying a whole bunch. It's not a fun experience. I've got a staff that is carrying a whole bunch. So I don't know that that is the best direction for the board to go in. But I think it would probably have to be explored. It is a possibility.
Mr. Burke.
I guess I wonder, we just minutes ago, we heard Cindy say she's got a phenomenal management team. She's got a wonderful legal department. What would possess anyone to suggest that there needs to be a change in leadership? You know, some people have expressed concerns that we shouldn't be saying, we shouldn't be talking frankly with Cindy. But here's the thing, we just insulted her. We basically said, look, Cindy, we heard what you had to say, and we're going to come up with another suggestion. We're going to suggest that perhaps the county attorney should take over legal. You know, I'll tell you, it is mind-boggling the boldness of some of our legislators in assuming that they know better than what our county department heads know. I can't even express words to tell you that I'm insulted for Cindy. She is a very, very competent leader. She has a master's in business administration, solid background, and as far as I'm concerned, she's done a fantastic job in the very short period of time she's been here. Yet we have the nerve to suggest that we should take away part of her leadership and farm it out to somebody else. How ridiculous, how stupid. Not just ridiculous, it's stupid. And I'm going to tell you, Steve, I have no problems. I think you do a good job for the county, but this is Cindy's domain. If something goes wrong in social services, we are going to hold her and her team accountable.
Mr. Forsyth.
I'd like to respond.
Go ahead.
I'd like to go first. Go
ahead, Rick.
Rick, I'd like to go first, please. First of all, Miss Ackerman, I was on the interview team, a wholehearted supporter. Okay, so there's no question about who I support, and I don't know anything about legal in social services. My question was, and I never got the answer to it, but the support, did the DSS attorney not request the county attorney take over support? Was that not the original that triggered this whole scenario? Am I right or wrong in that? I'm right. I think I'm right. So anyways, if there's a change, if there's been a change of heart or a change of mind, I get it and I understand it, but just let me know where we're at with it, because I'm not in that email loop. Are we deciding that it's probably not the best way and to handle it internally at the DSS? That's all I'm questioning. I guess we got all different directions with this, so.
Rick Perkins had his hand.
Rick, go ahead. Rick.
Well, you know, you may be offended, John, but so am I. You know, it wasn't stupid. You can call it whatever you want. I'm looking out for the best interest of the county. The support is what I'm looking at. It looks like there's power struggle or something here. I'm not sure. But if the department needs the support, that's what I'm interested in giving them, all the support we can. Mr. Button's county attorney office is very capable, and I think they could certainly help give all the extra they need. I've had enough.
Any other discussion? I'd like to just say one thing, and that is I was very caught by Ms. Haggard's assessment that the Department of Social Services Commissioner is not answerable to the county board. And it's only the state that is the person, the entity that she's responsible to answering to. And if that's the kind of advice the county commissioner, the new county commissioner is getting over there, it's no wonder there may be a little bit of animosity here or questioning about what's going on, because it's obviously not the way this board feels. And so if the legal department over there is trying to convince the commissioner that she doesn't answer to us, but only to the state of New York, then we should have maybe a meeting to clarify it in our new commissioner's mind for sure who she does answer to. Go ahead, Mr. Arquette.
Thank you, Mr. Chairman. The animosity was driven by an individual who did not reach out to the commissioner directly for information before emails were sent out with the ill tone towards her actions. So that's what started the whole thing running. We now know many things since those emails went out. And I think that the Department of Social Services under Cindy's leadership, under the leadership team that she has right now, are heading us in the right direction. That's where the conversation should end, in my opinion. Thank you.
Any other discussion? No more further discussion. Let's go on to new business now. That was under old. No new business? Okay. Let's have committee reports. You got any from the floor? Any on the screen? No committee reports? Ruth, is there a need to go into executive session?
There is for litigation, personnel, which is the medical, financial, credit, or employment history of a particular person or corporation or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation, and appointments.
Sure. Motion to go into executive session. Any opposition? Discussion? Favor? Opposed? Carried. Now for Mr. Akers, reappointments. Mr. Akers.
Mr. Chairman, I offer Peter Ryder for the Workforce Development Board, and I also offer Don Sadu for the Fish and Wildlife Management Board for Region 6. Move their nominations.
So moved.
Second.
Seconded. Any discussion? Further discussion? All in favor?
Aye.
Opposed? Carried. Now for chair's appointments. We have the names of the people on the Public Health Committee. And they are Joe Lightfoot, Nicole Terminelli. And those are my appointments, and Dr. Williams has come up with Dr. Kathleen Terrence, Terrence, and a Dr. Scolari Smith, first name being Jessica. And Ruth and Johnny will be involved as well. with that committee, and the optional people will be myself and Dr. Williams. On the Consolidation of Services Committee that deals with Augsburg's request, I'm appointing the already established St. Lawrence County Consolidation Committee that's chaired by Dan Fay. And along with Dan Fay, there will be Margaret Haggard, John Burke, Joe Lightfoot, and myself, like on all committees. The department heads, the way I envision it happening, the department heads from the appropriate areas that will be affected will work with our administrative staff to consolidate the data that's needed. Once the data is collected, when they present their findings to the consolidation committee, and at different stages, maybe all at once, but most likely different stages, that they'll be giving their findings to that committee, and then that committee, once they receive it and discuss it, and agree on it, will come to the full board, and we'll all get a say in terms of who the selection will be. That's it.
Move to adjourn. Second.
A motion to move to adjourn by Mr. Fay, second